webinar series. We would like to welcome you on our journey of 374th milestone. I'm really grateful to all speakers, guardians, mentors, resource persons that you have enabled us to continue the journey up to the infinite time, because this is our first step. As I am thinking, we are thinking, we are going to complete our 404th century of webinars after 13th August of 21. So 13th August, we have not completed 2 years. On 20 March, when Modi ji declared Janta Curfew, we started on 25th our YouTube channel, and we started the journey of international webinars right from 13th August of 2020, sorry. So I am really grateful. Again, I would like to communicate my sincere thanks with regards to all speakers, all contributors, due to which continuously we are being recognized by every record of book of records. Today I have received Asia Book of Record. Day before yesterday I received India Book of Records, and before that International Book of Records. Now I am trying to apply for my big team who has contributed like anything, sincerely contributed. Just see the example of dedication towards Ayurveda. Harish Verma ji is regularly joining from Canada. At the time at his place is 6 a.m. So it is really after just breaking the sleep, he is joining every day. Agnikarma ji from Haridwar, today he is in Gurugram, just reach in Gurugram. So really I am overwhelmed, and number one, I am continuously communicating my deepest regard, highest regards with sincere thanks to all guardians, mentors, speakers, and resource persons. Today, there was no day to celebrate which could be related to our Ayush, but I am thankful to Dr. Babulal Barala, who initiated the flame of Agnikarma. And Agnikarma is very unique subject where we will be going to listen, we will be going to learn from two expert speakers, Dr. Umendra Singh and Dr. Ravi Gogia. It is a unique subject, now popular also. Just to remember from my side, my father was director of Ayurveda in Madhya Pradesh. At his age of 45, he did his PhD. He was the first HPA of Jamnagar from 1956. And he did his PhD from Rajasthan University in Kaya Chikitsa mein Agnikarma. Very unique subject, not in surgery. Kaya Chikitsa mein Agnikarma. And I hope that was the first PhD thesis of that institute under Shastri ji, Swami ji. So Agnikarma, definitely I have to learn, we have to learn, and the need is practice. I again would like to request the new joiners, please join with real name, because after our journey of 223rd webinar, we have been victimized for Zoom mobbing. If we allow one person without knowing him or her, 20% suddenly enter into our webinar, make nuisance, and we have had to stop our 2 webinars and send link again. So I am really requesting all persons, because I have in front of me Redmi Note 9 Pro Max and iPhone, but I am fearing to admit them. I am unable to understand who are the joinee. So really, thank you. And now we are going to apply for our team, biggest team, representatives from all over the state of our nation, as well as 20 countries. So 50% will get that world record for this fastest and longest webinar series ever. Thank you very much. Now I would like to request Professor V.K. Agnihotri ji, ex-professor and head, Department of Swasthya Rishikul, Ayurveda University, Haridwar. Welcome, sir. Welcome.
Hello, Namaskar. Namaskar, Samaji.
Namaskar.
Thank you so much. I welcome all the dignitaries of today's webinar's platform, and also those who are the great scholars and speakers of today's webinar. Well, as you told me that your father had been there and he did PhD from Kaya Chikitsa department, that too on the subject Agnikarma. So it itself gives a lot of information that you are directly attached and had been attached with him. So good informations are there, and I think you will be a good judge to see of today's persons how they are going to perform. It's not a matter that the subject is being taken for PhD or for clinical method for Kaya Chikitsa under the heading of Kaya Chikitsa subject or the surgery itself. That depends on how it has been applied to the patient and how the patient was diagnosed to go for this karma. And when this Agnikarma was given to the patient, to which extent or to which percentage he got benefited. So this is the important. At the same time, for other pathies or for other approaches, how much he was treated for the same disease or for the same affected part. And in that comparison, if there had been a good percentage of the improvement by the Agnikarma, the value of Agnikarma itself establishes by its own efficacy. So I think with these welcome remark, I welcome all the speakers and our Hari Sharma ji, Doma ji, Pawan Sharma ji, all these things, and we will be waiting for your address. We will be enlightened with your information, and especially the work you have done in your clinic and your conversation with your patients as well as your students. That will go a long way. So the thing is that if you are in position to show us today the direct live demonstration, that will be wonderful. Otherwise, as such, in theme, we are always knowing for last decades, say 30 years or more. So we are still in wait that if you are going to give us some knowledge in a live form, that will be very good. So I declare this webinar open, and I welcome all the dignitaries, today's speakers, as well as the dignitaries of our present webinars platform. Thank you. Over to Pawan Sharma ji.
Thank you, sir. Thank you very much. I salute your dedication that you are.
आवाज नहीं आ रही आपकी?
I salute your dedication that you are in Gurugram and then also joined on time. Really.
No problem, no problem. अभी समय है सेरेमनी में, तो हमने कहा कि चलिए एक बार
स्वागतम.
इससे हम लोगों का भी उत्साहवर्धन होता है, आपका स्टेमिना जो बना रहता है, और हमारे स्पीकर्स को भी लगेगा कि उनके साथ एक बड़ा वाला छतरा, एक बड़ा अम्ब्रेला है जिससे वो कवर्ड है. तो ये तो गिव एंड टेक है, तो अच्छा लगता है. नो प्रॉब्लम.
थैंक यू सर. थैंक यू. मैं कनाडा से हरीश वर्मा जी से प्रार्थना करता हूं 2 शब्द कुछ शुरुआत में, फिर मैं उमेंद्र मीना जी को प्रार्थना करूंगा. डॉक्टर हरीश वर्मा फ्रॉम ऑन्टेरियो, कनाडा.
जी सर, प्रणाम. सभी आचार्यों को प्रणाम. पवन जी, आज का टॉपिक बड़ा अच्छा है और मैं तो लर्न करने के लिए ज्वाइन किया हूँ कि आज कुछ सीखने को मिलेगा. लेकिन मैं ये चाहता हूं कि जो अग्निकर्म का कॉन्सेप्ट है, इसको मॉडर्न तरीके से कुछ इसको मॉडर्नाइज किया जाए. इस पे आज थोड़ी चर्चा करेंगे. तो मैं उम्मीद करता हूं कि हमारे जो स्पीकर्स हैं, हमारे जो एक्सपर्ट्स हैं, वो इसको मॉडर्नाइज रूप में कैसे देखते हैं, उसकी कैसे इसको मॉडर्नाइज किया जा सकता है. क्योंकि अग्निकर्म के कॉन्सेप्ट को मुझे लगता है कि जैसे जो डायथर्मी है, इस तरह के जो इवन जो मैग्नेटिक वेव्स के साथ जो ट्रीटमेंट होते हैं मॉडर्न सिस्टम में, मुझे लगता है कि वो सारा कुछ अग्निकर्म का ही डेवलपमेंट किया हुआ कॉन्सेप्ट है। तो आज सुनते हैं कि हमारे एक्सपर्ट्स क्या कहते हैं। वेलकम सर। थैंक यू सर। ओवर टू पवन जी। थैंक यू।
Thank you, Harish ji. Thank you very much. So I would like to request Dr. Umendra Singh Meena ji, Senior Medical Officer, Diet and Yoga Expert, and in charge of Health Wellness Center, ex-resident doctor, Metro City Hospital, Alwar. Welcome, welcome, Dr. Umendra ji. Welcome. Welcome.
गुड इवनिंग एवरीबॉडी सर। सभी आचार्यों को प्रणाम। नमस्ते सर। मैं अपना टॉपिक शुरू करता हूँ, अग्निकर्म। आयुर्वेद में लोगों की थ्योरी रहती है कि आयुर्वेद धीरे काम करता है, लेकिन जब से मैंने अग्निकर्म प्रोसेस शुरू किया है के बाद में, सर आवाज आ रही है मेरी? थैंक यू सर। तो जब से मैंने अग्निकर्म किया है तो इसके इतने फास्ट रिजल्ट मिले हैं कि एलोपैथी से बहुत पीछे रह चुका है। और इसके जैसे पेन में मैंने काम किया है, इसको जॉइंट पेन, कहीं पे भी पेन है, उसमें इसके बहुत ही क्विक रिजल्ट है। तो इसको अपन कहाँ काम ले सकते हैं? पेन में काम ले सकते हैं, कहीं पे भी दर्द है, तीव्र दर्द है, कहीं पे भी दंत सूल है, दांत में कहीं पे भी दर्द है, तो उसमें बहुत अच्छा रिजल्ट है। बहुत ही फास्ट रिजल्ट इसके मिलते हैं। कहीं पे भी कोई घाव बना हुआ है, उसमें ग्रंथि बनी हुई है, उसमें बहुत अच्छा काम करता है। म्यूकोजल सिस्ट होती है, म्यूकस जैसे मुंह में कहीं पे भी सिस्ट बन गई है, तो उसमें बहुत अच्छा काम करता है। और लाइपोमा में भी इसका अच्छा काम है। तो सबसे पहले थोड़ा थ्योरेटिकल, फिर हरीश वर्मा जी ने कहा था कि इसको थोड़ा मॉडर्न वे में बताना है, तो मैं आज इसको प्रैक्टिकली और मॉडर्न वे में बताने की कोशिश करता हूँ। तो अग्निकर्म क्या होता है? The procedure performed by using Agni heat to cure various disease is known as अग्निकर्म। तो किसी भी तरह की बीमारी को अग्नि की सहायता से दूर करे, किसी भी बीमारी को, तो उसे वर्णन सुश्रुत संहिता में मिला है। सुश्रुत के सूत्र स्थान 12 अध्याय में इसका विस्तृत वर्णन है, और को अनुशस्त्र नाम से वर्णित किया है, जिसको अपन मॉडर्न वे में पैरा सर्जिकल प्रोसीजर बोल सकते हैं। वह है अग्निकर्म। अग्निकर्म अपन को क्यों करना चाहिए, इसकी क्या इंपॉर्टेंस है? तो सुश्रुत में बताया गया है, दग्धानाम रोगाणाम अपुनर्भवाद भेषज शस्त्र छारेर असाध्यानाम तत्साध्यत्वाच्च। मतलब कि अग्निकर्म से जो रोग को अपन दूर करते हैं, उसका रिकरेंसी बिल्कुल बहुत कम होती है। डिजीज ट्रीटेड बाय प्रॉपर अग्निकर्म हैज नो चांस टू रिकरेंस। और दूसरा बताया गया है कि जो अपन औषधि दे करके शस्त्र से अपन चिकित्सा करते हैं, उसमें जो बीमारी उससे ठीक नहीं हो पाती, वो अग्निकर्म से हम ठीक कर सकते हैं। ये इसकी इंपॉर्टेंस है। इसकी एक तो रिकरेंसी बिल्कुल 0% है, और जो अपन दवाइयों से ठीक नहीं कर सकते, वो अग्निकर्म से अपन ठीक कर सकते हैं। इसके 4 तरह के 4 टाइप्स हैं। पहला स्किन है, और त्वचागत जो भी, और दूसरा मांसगत, तीसरा स्राय स्नायु, शिरा और स्नायु, और चौथा है संधि और अस्थियों तक जो भी प्रॉब्लम होती है वहां तक। तो ये 4 टाइप बताए गए। और इसको अग्निकर्म को करने के मतलब इसकी शेप के आधार पर, अग्निकर्म शलाका कैसी होनी चाहिए, उसके आधार पर भी इसके 4 टाइप्स बताए गए। सर्कुलर है, पॉइंटेड है, स्ट्रेट लाइन और रबिंग, ये 4 प्रकार बताए गए। और इसमें आता है कि इंस्ट्रूमेंट क्या क्या काम में लेते हैं, तो उसमें भी थोड़ा इसमें विस्तृत वर्णन किया गया है कि त्वचागत में किन चीजों को काम में ले, शलाका के रूप में लिए, मांसगत में किसको काम में ले, शिरा स्नायु संधि में किसको काम में ले। तो इसमें बताया गया है कि मेनली वात और कफ प्रकृति है, वात और कफज जो व्याधि हैं, और जो त्वचागत है उसके लिए अपन पिपली काम में ले सकते हैं अग्निकर्म शलाका के रूप में, और गोदंत काम में ले सकते हैं। इसी तरह मांसगत व्याधि है तो उसमें जामुन की गुठली है उसको गर्म करके चिपका सकते हैं। और दूसरा है धातु, इसमें लोहे के अलावा अन्य जो भी धातु है, जैसे तांबा हो सकता है, अपने सोना हो सकता है, में ले सकते हैं। और तीसरा इसमें बताया गया है कि जो शिरागत या स्नायु संधिगत व्याधि है उसमें अपन क्या काम में ले सकते हैं, उसमें मधु के द्वारा, गुड़ के और स्नेह में घृत और तेल के द्वारा अपन अग्निकर्म कर सकते हैं, इनको तपा करके। सामान्य रूप से पंच धातु शलाका मॉडर्न वे में आजकल ज्यादा यूज हो रही है, जिसमें कॉपर और फेरस है, जिंक है, चांदी है, सोना है, इन 5 धातुओं को मिक्स करके बनाया गया है। लेकिन मेरा मानना है कि पंच धातु के बजाय सिंगल धातु, चाहे कोई सी भी अपन यूज लें, उसको यूज लेना चाहिए, क्योंकि पंच धातु में सबका जो हीटिंग पॉइंट है वो अलग अलग होता है। और इसमें पंच धातु में क्या है कि ये टूटने का ज्यादा डर रहता है, जबकि आप सिंगल धातु लेंगे, चाहे आप लोहे की लें, चाहे चांदी की लें, चाहे सोने की लें, तो वो उसका हीटिंग पॉइंट एक फिक्स रहता है और वो ज्यादा लंबे टाइम तक चलती है। तो ऐसा हमने देखा है कि इसमें पंच धातु के बजाय सिंगल धातु यूज ले तो उसका ज्यादा अच्छा रिजल्ट देखने को मिला है। इंडिकेशन ऑफ अग्निकर्म, अग्निकर्म का इंडिकेशन बताया गया है सुश्रुत ने कि त्वक मांस स्रा स्नायु संध्या स्थि स्थिते त्वक रोजा अति उग्र रुजा वायु तुच्छित कठिन सुप्त मांस व्रणे ग्रंथि अर्श अर्बुद भगंदर अपची श्लीपद चर्म कील तिलकालक आंत्र वृद्धि श्राच्छेदु नाभिसु नाड़ी सोड़ित व्रणितु अग्नि क्रिया। मतलब अग्निकर्म अपन कहाँ कर सकते हैं, जहां तीव्र रुझा होती है वहां पे अपन अग्निकर्म कर सकते हैं। कोई दुष्ट व्रण है जो घाव भर नहीं रहा है, बार बार हो रहा है, उसमें अपन अग्निकर्म का बहुत अच्छा रिजल्ट है। ग्रंथि है उसमें बहुत अच्छा रिजल्ट है। आर्ष अर्बुद और भगंदर में भी, भगंदर जो बाह्य भगंदर है, इंटरनल नहीं, इंटरनल में अपन कर नहीं पाएंगे, जो बाह्य है उसमें इसका बहुत अच्छा रोल है। चर्म कील है उसमें बहुत अच्छा रोल है। तिल का लक में है। आंत्र वृद्धि है उसमें भी इसका बहुत अच्छा रोल दिखा है। अब इसका एक आता है कि कहाँ कहाँ नहीं करना चाहिए, कॉन्ट्रा इंडिकेशन क्या है इसके, कहाँ पे अपन को अग्निकर्म नहीं करना है। तो जो भी, एक तो शरद और ग्रीष्म ऋतु में अवॉइड करने को कहा है, अगर करना है तो अंदर एसी रूम में करें। और दूसरा है पित्त प्रकृति के जो है उनको नहीं करना होता है, जो भी पित्तज व्याधि है उसमें इसको थोड़ा अवॉइड करना चाहिए। और अगला बताया गया है कि जो दुर्बल है, बच्चे हैं और जो डरपोक है, वृद्ध है, गर्भिणी है, इनको अवॉइड करने को कहा गया है। और जो स्वेदन के अयोग्य बताए गए हैं उनको भी अग्निकर्म नहीं करना चाहिए। इसके बाद में सम्यक अग्निकर्म के क्या लक्षण है, अपन ये थोड़ा प्रैक्टिकल वो थ्योरेटिकल बता देता हूँ, उसके बाद में मैं प्रैक्टिकली बताऊंगा। जो मैंने किए हैं उनकी क्लिपिंग है मेरे पास में, वो मैं प्रैक्टिकली बताऊंगा आपको। तो सम्यक अग्निकर्म के क्या लक्षण है कि ये सम्यक हुआ है, तो उसमें सुश्रुत ने बताया है शब्द प्रादुर्भावो दुर्गंधिता त्वक संकोच त्वक दग्धे, मतलब त्वचा स्तर पर जो भी अग्निकर्म करते हैं उसमें शब्द प्रादुर्भाव, एक चटकी आवाज आना जरूरी होता है, हल्की दुर्गंध आएगी और त्वचा का हल्का सा संकोच होगा। इसी तरह जो मांसगत व्याधि है उसके लिए सम्यक अग्निकर्म के क्या लक्षण है, उसमें बताया गया है कि कपोत वर्णिता अल्प स्वैथु वेदना शुष्क संकुचित व्रणता च मांस दग्धे, मतलब मांसगत उसमें कपोत वर्ण का होना जरूरी। जब वहां अपन अग्निकर्म करते हैं मांसगत व्याधि में तो वहां पे कपोत वर्ण आना जरूरी होता है, और अल्प शुष्कता, शुष्क होता जाता है वो, और स्किन वहां पे हल्की संकुचित होती है और वेदना अपने आप कम होती जाती है। ऐसे स्नायुगत अगर कोई व्याधि है उसमें अपन करेंगे तो वहां पे सुश्रुत ने बताया कृष्णेन ने व्रणता स्राव सन्निरोधश्च स्रा स्नायु दग्धे। इसी तरह बताया गया है कि रूक्षता, मतलब हल्की ड्राइनेस आनी जरूरी है और अरुण वर्ण का होना चाहिए, जैसे संधिगत में कहीं पे भी करते हैं तो जहाँ पे अपन करेंगे संधिगत में, तो वहां पे रुक्षता आएगी, वर्ण का हो जाना चाहिए। सम्यक अग्निकर्म के लक्षण बताए गए हैं। इसमें प्री और पोस्ट प्रोसीजर क्या होता है? प्री प्रोसीजर में बस उसको एग्जामिन करना होता है, कहीं पे पेन है तो उसको पॉइंटेड करना होता है और होता है बस। उसके बाद में पोस्ट प्रोसीजर में जहाँ पे भी अपने अग्निकर्म किया है वहां पे मोस्टली नहीं बने और उसके बचने के लिए इसका जो प्रोसीजर है अग्निकर्म का वो बताता है। उस पे अपन को अग्निकर्म करना है, ट्रिगर पॉइंट अपन देख लेते हैं और उसको मार्क कर लेते हैं, पेन से कर लेते हैं या वैसे दबा करके, और एक पेशेंट से कंसेंट ले लेते हैं रिटर्न में कि भाई हम ये करेंगे, इसमें ये दिक्कत हो सकती है और ये इसके फायदे हैं, उसको पहले हम बता देते हैं। और फिर एक टीटी भी हम लगा देते हैं इंजेक्शन का, ताकि बाद में टिटनस वगैरह होने के चांसेस नहीं रहे, ताकि क्योंकि अधिकतर मोस्टली लोहे की सलाखा अग्निकर्म में काम में लेते हैं। हालांकि इसकी अभी तक कोई ऐसा मेरे केस आया नहीं कि किसी की टिटनस हो गई हो। और पेशेंट की प्रॉपर पोजीशन ले लेते हैं, फिर वहाँ मार्किंग करके क्लीन द एरिया जहाँ पे अपन को अग्निकर्म करना होता है वहाँ पे त्रिफला क्वाथ से क्लीन कर लेना चाहिए। उसके बाद में जो रेड हॉट सलाखा होती है वो लेते हैं और जहाँ पे मार्क किया है वहां पे जस्ट टच करते हैं, और टच करने के बाद में इसका सबसे इम्पोर्टेंट चीज है वहां पे चट की आवाज आना जरूरी होता है। और फिर उसके बाद में जैसे ही अग्निकर्म हो जाता है उसके बाद में एलोवेरा का पल्प अपन वहां पे लगा देते हैं। उसके बाद में मधु घृत या हल्दी को त्रिफला के साथ में मिक्स करके बैंडेज कर देते हैं और पेशेंट को बोलते हैं कि लगभग 24 घंटे तक 24 आवर तक इसको भिगोए नहीं, गीला नहीं करे, ताकि कोई इन्फेक्शन नहीं हो। इसमें मैं अब आपको मैंने जो प्रैक्टिकली किया है उनकी स्लाइड्स है वो मैं शेयर करने की कोशिश करता हूँ, देखता हूँ इसमें कहाँ पे आएगी।
शेयर स्क्रीन।
हाँ सर, शेयर स्क्रीन में करता हूँ। बट नाउ एक मिनट लोड हो रही है सर ये। इसमें मैंने क्या सर प्रैक्टिकल किए हैं, तो उनके पेशेंट के फीडबैक भी हैं इसमें, और प्रैक्टिकली जो किया है वो सारा मैं आपको दिखाता हूँ। ये एक मिनट में निकालता हूँ।
In the meantime, I welcome Dr. Madan Thangvelu sir from Cambridge, UK, Dr. Vishnu Priya Das ji from Goa, Dr. Bharat ji from Bhopal. Welcome, welcome. I welcome all. Preeti Chawla ji, welcome.
Pawan ji, namaskar.
Pranam sir, pranam sir.
Namaskar. Very happy to see such a large number of people. आज इतने पूरा भीड़ यहाँ लग गया.
Today's subject is unique, sir.
Very, very wonderful. So very happy to be here. I can see Harish ji, Agnikarma ji, pranam.
वीडियो मिल नहीं रही है।
Vishnu Priya ji, namaskar ji.
डॉक्टर मदन जी प्रणाम।
अच्छा, शाबाश डॉक्टर साहब. हरीश जी नमस्कार.
नमस्कार सर, नमस्कार.
अग्निहोत्री जी नमस्कार.
नमस्कार.
प्रणाम जी.
उमेंद्र जी कोई प्रॉब्लम है शेयर करने में?
सर वो मेरे को वीडियो मिल नहीं रही, वीडियो देख निकालता हूँ मैं, ताकि उससे क्या आपके बहुत अच्छा क्लियर हो जाएगा, जो भी अपने पार्टिसिपेंट्स हैं उनको बहुत क्लियर हो
यूट्यूब की
जाएगा।
वीडियो तो नहीं है ना?
यूट्यूब की नहीं, मेरी खुद की बनाई हुई है सर,
वाह, वेलकम
कैमरे
वेलकम
से।
वेलकम, स्वागतम।
कैमरे से बनाई हुई है। तो ये किस में मिलेगी मेरे को, ये मैं देख रहा हूँ इसमें।
तब तक आप अपना
सर,
वक्तव्य चालू रख सकते हैं, उसको खोजते खोजते,
हाँ हाँ
जिससे
सर, मैं
पॉज ना हो।
बिल्कुल बिल्कुल बिल्कुल, दोनों काम अपने साथ में होते रहेंगे। इसमें सर जैसे हम करते हैं वहां पर, तो एक तो मैंने बताया था कि सम्यक दत्त होना जरूरी है। हमारे क्वेश्चन आता है कि कई बार भाई इसके क्या क्या व्यापद हो सकते हैं, क्या क्या परेशानी हो सकती है इसमें। तो एक पूछा गया था क्वेश्चन हमसे कि अतिदग्ध हो जाए तो क्या करें। तो अगर सम्यक दग्ध होगा तो कोई भी परेशानी आती नहीं है, फिर भी अगर कहीं पे भी अगर अपन से गलती से ज्यादा हो जाता है अग्निकर्म, तो उसकी जो व्रण चिकित्सा है उसकी तरह अपन चिकित्सा कर सकते हैं। और एक है जैसे साइटी का है हृदय, उसमें अगर अपन को अग्निकर्म करना है तो पहले एक सलाका को जहाँ पे भी उनका ट्रिगर पॉइंट है, पेन है, वहां पे एक सलाका से हल्का सा दबा करके और फिर वहां पे गर्म करते हैं, उसको हीट को पहुंचाते हैं, उसका एक तरह से स्वेदन कर्म करते हैं, उसके बाद अग्निकर्म करते हैं, तो उसका बहुत अच्छा रिजल्ट आता है। एक तीसरा था कि भाई इसके निशान रह जाते हैं तो क्या करना चाहिए। तो अगर सम्यक दग्ध करेंगे, प्रॉपर अपन अग्निकर्म करेंगे, तो उसमें कोई भी निशान रहने के चांसेस बिल्कुल 0% होते हैं सर, कोई भी निशान नहीं रहता है। और एक जैसे कॉर्न का है, कॉर्न से सबसे ज्यादा दिक्कत आती है। कॉर्न में हम अग्निकर्म करते हैं, तो उसमें जब लास्ट पॉइंट तक अग्निकर्म करते हैं, जब तक पेशेंट को पेन शुरू नहीं होता, क्योंकि कॉर्न में क्या होता है कि डेड सेल्स होती है, वो ऊपर आती रहती है, और उसमें जब अग्निकर्म करते हैं तो पेशेंट को पता ही नहीं चलता। लेकिन जैसे ही लिविंग सेल्स आती हैं, वो अग्निकर्म करते करते, तब पेशेंट को पता चलता है कि हाँ अब मेरे दर्द होने लगा। तो हम उस के बाद बंद करके और उसमें फिर जो खाने वाला चूना होता है उसको भर के और उसकी बैंडेज करके भेज देते हैं, फिर अगले वीक दोबारा बुलाते हैं। तो ऐसे करके 2-3 सीटिंग में उसका कॉर्न है वो पूरी तरह दूर हो जाता है। इसी तरह दंत सूल में बहुत अच्छे रिजल्ट देखे हमने इसके। जहाँ पे भी पेन है उसमें थोड़ी सावधानी बरतनी पड़ती है कि कहीं और दूसरी जगह नहीं लग जाए, क्योंकि वो बिल्कुल नाजुक जगह होती है मुंह। तो वहां पे जैसे ही अगर अपन पता कर लेते हैं कि इस दांत में दर्द है और वहां पे अगर करते हैं, तो बिल्कुल हाथों हाथ इमीडिएट रिजल्ट मिलते हैं, बहुत इमीडिएट। सर मेरे को इसमें मिल नहीं रही, कहाँ पे मिलेगी ये कैमरे से मैंने सेव की थी, पर इसमें कहीं दिखा नहीं रहा वीडियो।
तो गैलरी में सर्च कर लीजिए एक बार।
गैलरी में तो बैग जाकर के गैलरी में जाना है।
ये पहले से खोज लेना अच्छा था मीना जी,
हाँ हाँ सही सर, मेरा क्या है ये
पॉज हो जा रहा है ना।
हाँ हाँ, एक मिनट सर, मैं
अपने
गैलरी
अपने
में
किसी
जाता हूँ।
अपने किसी स्टूडेंट असिस्टेंट से कह दीजिए, वो बीच वो लोकेट कर लेगा,
बिल्कुल
सर्च
सर,
कर
मिल
लेगा।
गया है मेरे को।
ठीक है, चलिए ठीक है, ठीक।
हाँ
हाँ, ये
हाँ
लोग कर
सर,
देंगे।
मिल गया मेरे को।
गुड गुड, लकी है आप।
वीडियो शेयर करते वक्त नीचे के 2 ब्लैंक टिक करना मत भूलिएगा, नहीं तो आवाज नहीं आएगी।
अच्छा अच्छा
जब
सर,
शेयर करेंगे,
ठीक।
वीडियो शेयर करेंगे, तो नीचे लिखा रहेगा ऑप्टिमाइज फॉर वीडियो एंड फॉर ऑडियो, तो दोनों टिक कर देंगे तो उसकी आवाज भी आएगी।
अच्छा, गैलरी के में जाने के बाद मेरे को वीडियो तो मिल गई, अब इसको शेयर कैसे करना है।
पहले शेयर स्क्रीन कीजिए, शेयर स्क्रीन के बाद फिर आपका क्या कहते हैं उसका जो भी खोलना है वीडियो वो खोल लीजिए।
अच्छा अच्छा सर। एक मिनट।
डॉक्टर उमेंद्र सिंह है।
हाँ जी, यस मैम,
उमेंद्र सिंह।
यस।
आया आपका भी? यूट्यूब पे कितने बंदे हैं यूट्यूब पे? 4। तो यूट्यूब पे तो लिंक होता है, इसमें इतने 35। अच्छा, सबके इंटरेस्ट का टॉपिक भी नहीं है, सबको पोटेंशियल भी नहीं पता। हाँ?
Is there any problem, Dr. Umendra?
सर वो मेरे को क्या है, वो वीडियो इसमें दिखा नहीं, गैलरी दिखा नहीं रहा। जैसे ही मैं इसमें जाता हूँ ना स्क्रीन शेयर में,
तो मैं आपसे यदि आपसे अनुमति लेके मैं डॉक्टर रवि गोगिया जी को आमंत्रित करूं, तब तक आप खोज लीजिए और टेक्निकल प्रॉब्लम दूर कर लीजिए। तो
हाँ 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 सर, बिल्कुल बिल्कुल सर। फिर मैं जो
उचित
प्रैक्टिकल है
रहेगा।
वो मैं बाद में बता दूंगा।
जी जी जी, मैं आपका इंतजार करूंगा, लेकिन
वो भी
आप
अरे
वीडियो
पवन
श्योर
जी,
सर, श्योर।
हो जाइए।
पवन जी वो तो अच्छा ही है। मोरओवर ये जो अपना प्रेजेंटेशन दे रहे हैं ये पूरा खुद ही अपने में कंप्लीट और सारगर्भित है। जो इन्होंने बातें बताई दंत शूल से लेके और आगे तक के जितने भी इंडिकेशन बताए हैं, तो इन एनी केस अगर टोटल फेल्योर होता है, नहीं ट्रेस हो पाएगा, तो भी अपना वक्तव्य वो पूरा जरूर करेंगे।
हाँ,
ये
नहीं,
मेरा
वीडियो वी ट्रांसफर से भी भेज सकते हैं जो हम लोग दिखा सके।
जी जी, उस बीच
अच्छा।
हम दूसरे गेस्ट को बुला
बहुत
लेंगे।
कुछ
ठीक
सॉल्यूशन, बहुत कुछ है ना उसमें, टेक्निकल ग्लिचेज हैं, ये हर
हाँ
समय
सर,
होता
मैं
है।
आपको किसको भेजूं?
ठीक है, इस बीच अब दूसरे गेस्ट को बुला लेते हैं, जिससे कि वे इनका बाद में कवर कर लेंगे। ठीक है,
जी,
ठीक
जी।
ठीक ठीक सर।
ठीक है, थैंक यू सर।
ओके ओके सर।
मैं
पवन जी वेटिंग रूम में 2 जने हैं, वी कांट आइडेंटिफाई देम, उसका क्या करना चाहिए जी?
नहीं, एडमिट नहीं करना है सर। मैं
अच्छा
उनको बार बार हम चैट बॉक्स में लिख रहे हैं,
अच्छा
प्लीज ज्वाइन विद रियल नेम। उन लोगों को हम 2 बार लिख चुके हैं,
अच्छा
बट वो आईफोन और सैमसंग
हाँ
अभी
जी,
तक अपना नाम नहीं प्रकट किए हैं।
बिल्कुल जी,
तो मैं आशा करता हूँ फिर वही वो जूम बॉम्बिंग हो जाएगी सर।
बिल्कुल जी।
तो मैं मेरे भाई डॉक्टर रवि गोगिया जी को आमंत्रित करता हूँ। आई वुड लाइक टू इनवाइट डॉक्टर रवि गोगिया, आयुर्वेद कंसल्टेंट, डिपार्टमेंट ऑफ काय चिकित्सा, STMC आयुर्वेद पंचकर्म हॉस्पिटल, न्यू दिल्ली। वेलकम डॉक्टर गोगिया जी। नाउ स्टेज इज योर्स। वेलकम।
Thank you. Namaskar to all. Myself, Dr. Ravi Gogia.
वेलकम।
Om Namah Shivaya.
ओम नमः।
Naman to my Guruji, Dr. Narendra Gujarati ji and Dr. Uday Talar from Jalgaon, who taught me Agnikarma. This is the magical technique that gave me a unique identity. So this helped me to get rid of pain of ailing society. This is the blessing from God, which I have come to know about Agnikarma from my Guru. I salute to them. I bow my head to them. I am very thankful to Dr. Pawan Kumar Sharma for inviting me as a guest, inviting me as a speaker on this webinar that is termed as practical aspect of Agnikarma. I congratulate him for winning award in International World Record of Excellence on 10th of April 2022 for organizing 400 international webinar. I salute you for the propagation of Ayurveda among students teachers, and all medical practitioners. I really appreciate for your endeavor given to society. Now, I would like to show my PPT that is shown to you. Agnikarma. Agnikarma is the ancient gift of analgesia. That means in the phase of fast food life, each and every person wants to have quick result through any pathy. But Ayurvedic persons, Ayurvedic Veds thinks that we can't do anything else. We can't render any quick result with any Ayurvedic medicines. But we are wrong, because Agnikarma is a magical charismatic technique by which we can induce quick result, no side effects, and this is a gift of God, gift of Ayurveda, being practiced by our clinician for the last many years. So it has been mentioned in Sushrut, Sutrasan Uttarard, 12th chapter. And what is the definition of Agnikarma? Agnikarma definition is Yat Chat Chat Shabd Pradubhav Bhavti Tat Agnikarma Uchyate. That means where there is a sound known as Chat Chat, that means Agnikarma is there. Agnikarma is made up of two words, Agni and Karma. That means Agni, that is the karma which is where Agni is involved for the treatment of chronic ailments, which gives instant relief in pain, no medicine required. So this is the best therapy. Why it is best? Because Daha Sankocha Sira. That means it creates local vasoconstriction. That means there would be no bleeding. There would be no bleeding. So this is the best. Second, why it is best? Second number of option is because it destroys local bacteria. There will be no chances of suppuration, no chances of bacterial growth. So there would be early healing also. In modern science, it has been compared with cautery. There are two types of cautery, galvano cautery and Pockline cautery. Galvano cautery means where heat is generated with the help of electricity, and Pockline is any instrument is heated on the heat source and applied over the affected site. So here in Ayurvedic terminology, we are using Pockline. We are using Agnikarma since 5,000 years back, but modern people have used a new term, Pockline, in their language. But we are more advanced than their therapy, because we are using at the same time we had used Agnikarma for the last 5,000 years back. So our therapy is older than this new term. So whenever we experience pain, few procedures are being undertaken by us. Firstly, the person comes to us with pain through any trauma or any vitiation of doshas. First procedure is given to them, that is Snehan. Snehan means Abhyangam. Abhyangam means massage. It has one shloka is mentioned in our classical text that Abhyang Achret Nityam Sa Jara Shram Vataha Sunidra Sutvak Dadim Krita. That means the person who undertakes Abhyang daily, he is free from Jara. Jara means old age. Shram. Shram means fatigue. Third one is the Vataha. That means he would be free from all types of joint disorder, painful disorder. Sutvak, that means his skin will be soft, just like child. Sutvak Sunidra, he will have a sound sleep. And Dadim Krita, that means the muscle will be tonified. These are the benefits of Snehan Abhyangam. So whenever person comes to us, we give Snehan. If the person pain does not get relief, we give other therapy that is known as Svedan. Svedan means fermentation. It is a process by which sweating is induced. It is of two types: Ruksvedan, Vashvedan. Ruksvedan is done for the sake of Sam disorder. Sam means just like Amvat. We'll have to give Ruksvedan. In case of Niram condition, we'll have to give Vashvedan. That is in case of osteoarthritis. In case of Sandhivat, we'll have to give Vashvedan. Other types of Svedan are hot fermentation, which is usually done for the sake of chronic pain. Second is cold fermentation. That is usually done for the sake of acute pain. So first is Snehan, second is Svedan. If the patient does not get relief in pain, so we'll have to move to other therapy that is known as Upna. Upna means here medicated herbs are mixed, cooked, and made in lay form and just tied over the affected area. That will act as a Upna. That will give Snehan, Svedan, that will give healing property also. So this third procedure is also giving you pain relief. But if it is not giving pain relief, we'll proceed to Rakt Mokshan. Rakt Mokshan, what it is? It is type of bloodletting which is usually used for Pitta disorder, Rakta disorder, and there are three types of Rakt Mokshan by which we are doing this therapy. That is, firstly, is we can do Rakt Mokshan through Shring. Shring means if it is Vatic disorder, we'll have to use Shring for bloodletting, for Rakt Mokshan. Shring, Jok, Alabu. In case of Pitta disorder, we'll have to use Jok. Jok means leech therapy for the sake of bloodletting, for the sake of Rakt Mokshan. Third one is the Kapha disorder. For the sake of Kapha disorder, we have to use Alabu. So these four therapy we'll have to apply in order to get rid of this pain relief. If the fourth therapy does not give any relief, that means we'll have to switch over to Agnikarma. Agnikarma is the best and last choice. Firstly, there is no need to give Agnikarma to all people. Firstly, series wise, we'll have to first select Snehan, Svedan, Upnaha, Rakt Mokshan. Last one is the Agnikarma. It is the best, but it should be done at the last. Okay. What is the purpose of Agnikarma? There are three types, three purpose of Agnikarma. Firstly is pain relief. Second is cosmetic purpose. Third one is a specific disease wise, because specific disease gives you few specific points where we have to do Agnikarma. So these are the three purposes by which we are using Agnikarma. So I would like to show this video of backache. Just see. ये क्या हुआ? ये क्या हुआ देखना? आवाज नहीं आ रही. ये म्यूट क्या है? आवाज नहीं आ रही.
आपके स्क्रीन में दिखाई दे रहा कि नहीं?
सर स्क्रीन में दिखाई दे रहा है, वॉल्यूम नहीं आ रहा, इसको कहीं से म्यूट हुआ है. प्लीज म्यूट अवे फ्रॉम शेयर्ड एप्लीकेशन.
गोगिया जी,
हाँ जी.
जो वो पवन जी ने जो बताया कि इसकी वो नीचे अगर देखो तो उसमें वो ऑप्टिमाइज करके शायद पवन जी एक्सप्लेन करेंगे आपके लिए.
सुनो क्या कह रहे हैं
पवन
जी, मुझे बताइए एक बार.
पवन जी एक बार बता देता हूँ.
आपकी स्क्रीन तो शेयर्ड है लेकिन आपके वीडियो नहीं दिख रहे हैं.
हाँ वीडियो देखो, इसको करे डबल क्लिक करना है. मैं अपनी डॉटर से थोड़ा हेल्प ले रहा हूँ, वो थोड़ा हेल्प करेगी मेरी।
No
बिल्कुल।
problem, no problem, sir.
आप बताइए क्या तकलीफ होती है आपको?
मेरे को ये
आ तो रही है, अभी आ तो रहा था।
गोगा जी, जो पावर पॉइंट स्क्रीन को बंद करके ट्राई करना जी।
वीडियो विजिबल है क्या आपको?
नहीं जी, पावर
वीडियो
पॉइंट
विजिबल नहीं
दिखा,
है।
We
पावर
were
पॉइंट
able to
दिखा।
hear a sentence of yours, but there was no visual. अभी आपने जो प्ले किया था, we were able to hear a sentence, just a sentence, no visual.
हाँ, आ गया जी।
अपना राइट हैंड जो बाजू है वो जरा पीछे करने में बहुत तकलीफ जैसे अभी हो रही है, तो जैसे कुछ
आप बताइए क्या तकलीफ होती है आपको?
मेरे को ये अपना राइट हैंड जो बाजू है वो जरा पीछे करने में बहुत तकलीफ जैसे अभी हो रही है, तो जैसे कुछ एक चुभन सी होती है पीछे।
यहाँ का यहाँ दर्द होता है? इधर थोड़ा पीछे करो।
हाँ जी, हाँ जी।
यहाँ दर्द है?
हाँ, बस ये इसी एरिया में।
इस एरिया में दर्द है, मैंने निशान लगा दिया।
हाँ जी। ये एकदम मैं फ्रीली हाथ उठा नहीं पाता पीछे।
ओके, हाँ ठीक है।
हाँ जी, थोड़ा सा ऊपर से ये इसके अंदर है कुछ।
मैं निशान लगा देता हूँ। ठीक है, चलो अभी कर रहे हैं इसको।
अच्छा,
बस हो गया। बस हो गया। अच्छा, अब आप बताइए दर्द आपको कैसा लग रहा है? जैसे पहले दर्द हो रहा था यहाँ पर।
हाँ जी,
दर्द
ये थोड़ा सुडौल होना शुरू हो गया जी।
मतलब
रिलीफ होना शुरू हो गया।
शुरू हो गया।
हाँ, वो एकदम जो
जैसे मैं यहाँ दबा रहा था, आपको पहले यहाँ दर्द हो रहा था ना, इधर मैंने निशान लगाया।
हाँ जी, हाँ
अभी
जी।
दर्द है?
नहीं, अब नहीं,
बिल्कुल नहीं है।
नहीं लग रहा है बिल्कुल।
बहुत अच्छा लगा।
ठीक लग रहा है
बिना दवाई के। अच्छा लगा ना?
बिल्कुल। ये देखो मेरा अब शोल्डर भी जा रहा है।
ये तो मैजिक हो गया।
ये तो बिल्कुल मैजिक है ये।
चलो थैंक यू, ओके बाय।
शाबाश गोगिया जी, बहुत बढ़िया।
पीछे आगे करो उसका, एक सेकंड वीडियो भी है ना, सर्वाइकल। ये ड्यूरिंग ट्रीटमेंट। This is the case of cervical spondylitis for which we are doing Agnikarma. So this is the clip of during treatment of cervical spondylitis through Agnikarma. Aloe vera, in other hand, in order to give instant coolant effect of this aloe vera, because Agnikarma gives burning sensation. In order to get rid of this burning sensation, we have to apply aloe vera. Patient is bearing pain, so I have not applied. Generally, after doing Agnikarma, we have to give. After giving this therapy, what is the response of patient after this therapy? Show other one. Next. This is the patient response after.
बताओ अपने किए, दर्द में आराम है?
हाँ जी,
आराम है?
आराम है।
ठीक। यहाँ दर्द पहले से कम है?
कम है।
और कहीं अब दर्द नहीं है?
नहीं।
चलो कुछ दिनों में ये निशान जो है चले जाएंगे। ओके,
ठीक है।
और अगले हफ्ते हम दोबारा बुलाएंगे आपको।
ठीक है।
पहले से दर्द में आराम है आपको?
हाँ जी।
तेज बोलो, आराम है या नहीं?
आराम है पहले से।
चलो ठीक है, थैंक यू।
Now we will move to next PPT now. Still not going on. Now, what are the instruments used for Agnikarma? Because it has been mentioned in a classical text that Piplej, Shakrit, Godan, Shar Shalaka, Jamboshtar, Tarloho, Shodr Gud, Sleshcha. These are the required instruments by which we can do Agnikarma. Pipli, Piplej means Pipli, Godan means cow teeth, and Shalaka. These are three instruments. Whenever Agnikarma is to be done, we are using these three instruments. And Jamboster and other metals. And as Dr. Upendra told that Panch Dhatu Shalaka is not so impressive, having impressive look, or does not stay longer. So better to have any metal Shalaka. And honey, good, Shodr, good, and Snehacha. These are the three ones which are used for Snigdh Agnikarma, because there are two types of Agnikarma: Ruksh Agnikarma, Snigdh Agnikarma. Ruksh means dry instrument that has to be warmed up till it becomes red hot and applied over the affected site. Snigdh Agnikarma means having oiliness. Oiliness means having stickiness. Consistence of that instrument would be oily. So it is usually Snigdh Agnikarma is usually done for the sake of Asandhi Snayugat Vat. And Ruksh Agnikarma is usually done for the sake of Twakgat Vat. And Jambost and other metals, it can be used for Twak and Masgat Vat. So these are the indication where we can use instrument of this Agnikarma. So just I have told you earlier what is superficial and deep Agnikarma. Superficial means whenever pain is situated at the level of Twak. That means we'll have to do superficial Agnikarma. That means we'll have to give Dagd at the level of Twak Gat Dahan. Whenever the pain is situated at deeper level, that means Asli Sandhi Snayugat Vat. So we'll have to give Snigdh Agnikarma. So these are the two classification by which we can do Agnikarma. So I would like to show one other this video that has been done at our hospital, that is for calcaneal spur. Calcaneal spur, it is the deposits of calcium spikes at the level of heel. The person, whenever he gets up early in the morning, he feels excruciating pain also. Whenever he gets up in the morning, just steps forward, he feels a great pain. So there is no treatment in allopathic because they are giving painkiller medicines, they are giving injections also, they are giving steroids also. At the last, they'll have to refer it for surgery. So Agnikarma is the best therapy for the sake of calcaneal spur. Within 4 to 5 sittings of Agnikarma, patient gets relief. So this is boon for all people having calcaneal spur. In Ayurvedic terminology, that is known as Vat Kantak. Kantak means person feels pain like thorn whenever he gets up and moves forward. So I'm going to show this video before treatment of calcaneal spur. What patient says.
यहाँ दर्द हो रहा है आपको, यहाँ दर्द हो रहा है, ओके, यहाँ दर्द हो रहा है,
कितने टाइम से दर्द है, पहले तो नहीं था? चलो चलो ठीक है,
I have to mark the tender point. As patient says, these are the tender points. I have to mark it and select it. And after, during treatment, I have to apply Agnikarma Shalaka over that selected area. This is the other patient. So, patient was having pain at her heel. So I am doing that specific area. You have to apply aloe vera along with it. As you just withdraw your shalaka, patient burning sensation over the affected area will get shut off. So it is very essential to apply aloe vera along with it. As this staff told me that instrument has got cold now, so we'll have to change this shalaka. We'll have to keep it under flame source. That should be red hot. If it is red hot, that will work. Otherwise, it will not have a relief in pain also. So after treatment, this one treatment, what patient says?
नहीं, मैं आपसे पूछ रहा हूँ, जब ये अग्निकर्म करने के बाद आपको आराम है या नहीं है? जैसे पहले दबाते थे दर्द होता था, अभी आराम है? एक बार उनकी फोटो लीजिए। अंदर जी आराम है आपको? ठीक है, पहले दर्द हो रहा था? ठीक है, ओके, थैंक यू।
Sir, these are the instant result, instant smile on patient's face. Whenever we see face smiling, this will give us a peace. This will give us a satisfaction, confidence raising also. So these are the best gift given to us by patient. If the patient says that I am free from pain, this is the best gift given to me. And second thing is the frozen shoulder. We'll let me show this video also. Before treatment. Before treatment, this one.
बताइए क्या प्रॉब्लम है?
ये यहाँ दर्द होता है, यहाँ हाथ उठता नहीं है, इससे ज्यादा उठ नहीं रहा, यहाँ दर्द है।
अच्छा, कौन कौन से पॉइंट में दर्द है जब आप उठाते हो?
ये सारा ही है, ये पूरा ही है।
ये
हाँ, सारा ही है।
ये दबाने से दर्द हो रहा है? ऊपर करो, दर्द होता हो? ये
हाँ।
ठीक है, यहाँ भी है तो यहाँ पर दर्द है?
यहाँ पर तो नहीं हो रहा,
ये यहाँ दर्द है?
हाँ है।
यहाँ दर्द है? ऊपर करो, ऊपर हाथ, इधर दर्द है?
नहीं, इधर नहीं है।
इधर नहीं, इधर। ओके, ठीक है। ये कितने साल से दर्द है आपको?
ये तो अभी 4-5 महीने हो गया।
5 महीने हो गए। आपको शुगर बीपी की प्रॉब्लम है?
हाँ, वो तो है।
कितने साल से प्रॉब्लम है?
शुगर तो 7-8 साल हो गए शुगर को।
बीपी भी है?
बीपी भी है।
ठीक है, अब हम आपका अग्निकर्म करने जा रहे हैं।
हाँ,
चलो, मेक इट ऑफ।
Now this is during treatment, during Agnikarma treatment. This is
जा रहे हैं रेड हॉट शलाका। दिस इज रेड हॉट शलाका। देखो, रेड हॉट शलाका हो गया। अग्निकर्म शुरू करेंगे। पहले करके दिखाओ जरा, कितना होता है मैक्सिमम? इतना होता है ना आपका? इतना, इसके ऊपर नहीं होता। ठीक है, छोड़ दो, घबराना नहीं, अपना ध्यान। दर्द नहीं होगा, थोड़ा होगा तो हम संभाल लेंगे।
You may be hearing this chat chat awaj. That means we are giving twak gat dagd. Chat chat awaj is there. That means twak gat dagd is there, and that has been completed. This is the limit of our Agnikarma, at which level we have to stop it. चट चट आवाज, that should be hearable to us, should be heard.
ठीक है, बहुत ज्यादा दर्द तो नहीं हो रहा अब? ठीक है,
बहुत ज्यादा तो नहीं होता है
वैसे जब भी ये लगाने से आराम आ जाता है,
जब हाँ ये लगाने से आराम हो।
हाँ बस ठीक है, ओके चलो हो गया।
Now after treatment, what patient says? Double.
इतना ही
इतना पहले आपका इतना था,
पहले इतना इतना ही
इतना पहले आपका इतना था,
पहले
इतना हो गया, बिना दर्द के हो रहा है? दर्द है अभी?
है तो
उतना ही दर्द है जितना पहले था?
थोड़ा कम है पहले से।
स्टिफनेस जो होती थी, भारीपन था?
हाँ पहले था, लेकिन अब यहाँ से ज्यादा ऊपर करते हैं ना,
मतलब इतना तो हो गया ना?
हाँ इतना।
अब धीरे धीरे अगले हफ्ते करेंगे तो और ऊपर हो जाएगा, ठीक है? चलो थैंक यू।
As this patient is having diabetes for the last 8 years, there is chances of delayed healing, delayed response in pain relief. So we can expect relief in coming few sessions. It requires 5 to 7 sittings of this Agnikarma to get rid of pain in case of frozen shoulder. Now we will switch over to next PPT. So what are the classification of Dahan? It has been classified as per Akriti, shape, Valle, Vindu, Vilekha, Partisaran. These are the 4 shapes of Agnikarma which we are going to underdo our patients having pain. Valle means round, Bindu means pointed. Valle means round. That is usually done in case of corn. And Bindu that is pointed. That is usually done for the sake of all types of painful disorder. And in case of Vilekha, Vilekha is usually done for the sake of apachi. That means lymphadenitis. It may be cervical lymphadenitis. It may be axillary lymphadenitis. And fourth one is the Partisaran. That means we have to rub shalaka horizontally towards that dead area, because it is usually done for the sake of painless hypergranulated area. That means dead area, just we'll have to remove the skin. So we'll have to rub it. That process is known as Partisaran. There are other 3 types of Ardhachandrakar, Swastik, Ashtapad. Ardhachandrakar and Swastik are usually done in case of Bhagandar, fistula. So these are the classification. I am going to show a video of Shetika. पीछे लगो, पीछे ओवर है क्या?
मनीष जैनी,
इसको एक बार ऑफ करना। This was the patient of Shetika. He came to me. He did Agnikarma for 3 sessions. After 3 sessions, he came to me. He told me what he has got relief from this Agnikarma. Just hear this word.
3 बार अग्निकर्म किए, तो 3 बार अग्निकर्म करने के बाद एक बार साइट दिखा दो कहाँ कहाँ किया। ये साइट है जहाँ हमने अग्निकर्म किया, और 1 वीक के इंटरवल के बाद हमने 3 बार अग्निकर्म किया, और इस साइट पर भी किया।
You will see the Agnikarma scar, the black shadow. These are the proof we have did it earlier.
ये निशान नजर आ रहे हैं आपको। अब पेशेंट से पूछते हैं कितना आराम है। अब पेशेंट मनीष जैनी, आपको इस थेरेपी से कितना आराम है?
काफी आराम है।
आपको दर्द की गोली तो नहीं खानी पड़ती? नहीं। ये जो अग्निकर्म करने के बाद?
नहीं, कोई पेन किलर नहीं खाता।
अभी क्या क्या चीज में आराम है बताइए।
जैसे कि मैं पहले आधा घंटा भी नहीं बैठ पाता था, तो अब ये है कि मैं आराम से 2 घंटे आराम से बैठ पाता हूँ नीचे।
ओके।
पहले मैं नहीं बैठ पाता था, पहले चल के मैं आता था, 10 मिनट मैंने वॉकिंग किया तो काफी पेन होता था बैठने पे। अब आधा घंटा मैं वॉकिंग करूंगा तो हल्का सा पेन होगा, 10 मिनट में वो ठीक हो जाएगा।
कोई और थेरेपी ले रहे हो या कोई
नहीं और
इंजेक्शन
कोई
लगवा रहे हो?
नहीं, कुछ भी नहीं।
इस थेरेपी से आराम है आपको? अग्निकर्म थेरेपी
काफी आराम है।
ओके, थैंक यू।
नेक्स्ट
वेलकम सर।
और दिखाओ जरा, करते हुए दिखाओ। नी ऑस्टियोआर्थराइटिस, संधिगत वात of जानुगत संधिवात। So how we are doing? Patient is having pain over this selected tender point. So we are giving Agnikarma towards those specified points. There is no need to do more because tender points are very minute and very small. So we'll have to do Agnikarma through selected points, selected tender point also only. Now we are shifting to other PPT. So these are the indications where we can use Agnikarma. Osteoarthritis of knee, heel spur, as you have seen earlier, and this one is little bit wart. This one is sciatica and frozen shoulder and cervical spondylitis. We had already shown to you. This is corn. So these are the general indications which you are using for the sake of pain relief. So what are the specific indications for painful conditions and cosmetic purpose? Painful conditions already described to you, Vat Kantak, Arsh Bagandar, and cosmetic purpose. Cosmetic purpose means the corn, moles, extra growth, granthi, apache, painless, hypergranulated, ulcer, arbut, keloid. There are no chances of relapse whenever we are doing this Agnikarma for cosmetic purpose, because Kadar, dead area would be burnt out, moles would be finished, extra growth will be extracted out, that would be excised through Agnikarma. There would be no cyst after Agnikarma. So there are no chances of relapse. Agnikarma gives a 100% boon activities if we are using for cosmetic purpose. But in case of painful conditions, if it is associated with degenerative disorder, we can give relief temporary to permanent, because we can't stop degeneration. We can delay the onset of degeneration. We can't disintegrate those dushes samurchana. So that's why the pain can come back. So in case of painful conditions, we'll have to give Agnikarma till the patient gets relief. So it is better than all types of analgesic medicines, because that creates gastric upset, renal disorder also. So this is the best therapy for immunocompromised or the person who does not want to have medications. So in case of painful conditions, it can be helpful by giving temporary to permanent relief. Now next, what are the requirements of Agnikarma? Because we can start it at our clinical OPD also. Firstly, we'll have to require Trifla Kashai, Trifla Kwat. You can make it at your home. Shalaka, any shalaka. That can be low, that can be panch dhatu. That means that is having panch metals, 5 metals: gold, silver, copper, brass, and iron. These are the 5 dhatus for your panch dhatu. So I think so single metal shalaka is better. You can use any type of instrument. That is not essential. You have to use shalaka also. You can use spoon also. You can use agarbatti also. That should be red hot. Where it can be used, you'll have to check it out and use it. Second, LPG gas stove. It can be kept at your clinic, at home. If the patient comes to your home, if the person is having, you may have family members for which you can do it. LPG gas stove will, whenever there is no LPG gas, because we are going to other space where there is no LPG gas, we can have artificial flame that is usually used for jewelry shop also. That gives instant heating effect to chalaka. There should be probe holder. This is probe holder. Probe holder. This is Swarn chalaka. Swarn chalaka is usually used for the sake of apachi. That means cervical and lymphadenitis and other painful disorder also. Swarn chalaka should have 18 carat. Length of this Swarn chalaka should be 7 centimeter. And these are the requirement of Swarn chalaka it should have. We can use it through haldi also. Haldi, because we can, whenever we are heating this haldi up to the mark of red hot, and this is specially used for sake of jaundice. And this is used at snuff point, because it is snuff point is at our that lies in between thumb and index finger at our hand. Just apply this red hot chalaka towards that specific area, snuff point, that will give you relief in jaundice. This is eatable lime. Whenever we are using corn, we are using Agnikarma for the sake of corn, because whenever we are inserting, we are applying that red hot chalaka towards that corn is dead tissue. Patient will not have any pain. Whenever we apply, that will not have any pain. Whenever dead tissue get burnt, the patient live tissue will start burning. The patient will feel pain. At that moment, we'll have to just withdraw that chalaka and apply eatable lime mixed with water. That will give instant cooling effect. This is the best treatment, best measure, economical measure in order to get rid of this burning sensation. Each and every type of Agnikarma requires aloe vera peels. That is usually available at our garden, wherever that is very easily available. In case of person comes to us, says that there is a burning sensation after whenever he move back to his home, we can advise them Madhuyashti Grit. That gives early healing and pain would be less and burning sensation would be low. So these are the requirements of Agnikarma. So what are the signs of Dagd? At which level we'll have to give Dagd? There are 4 levels by which we'll have to give Dagd. Twak Dagd. What are the signs by which we can identify the Twak Dagd is there and it is over? There is no need to move to Mas Dagd. Usually we do Twak Dagd and Mas Dagd in our clinical practice. Sira, Sanayu, Asti, Sandhigat Dagd is usually not done. Twak Dagd, what are the identities, what are the virtues, what are the qualities, what are the characteristics of Twak Dagd? Shabd Pradurbhav, Durgandhata, Twak Sankoch. These are the 3 signs of Twak Dagd. So, Shabd Pradurbhav. That means there should be sound of chat chat. Chat chat awaj, that is a specific required sound. If it is there, that means Twak Dagd is over. There would be bad smell and there would be constriction of that specific skin. So these 3 signs should be there whenever there is a Twak Dagd. In case of Mas Dagd, Kapot Varnata, Alp Shvathu Vedana, Shushk Varn Sankuchita. These are the 5 symptoms, 5 characteristics of Mas Dagd. Kapot Varnata means after doing Twak Dagd, other step is Mas Dagd. Firstly, you'll have to do Twak Dagd and move to Mas Dagd. Mas Dagd means Kapot Varnata. That means color of that specific affected point through Agnikarma would be Kapot Varnata, means pigeon-like. Alp Chethu Vedana. That means pain and swelling would be decreased. That point would be dry, and that ulcer, that point burnt point would be constricted. Previously, there was a Twak sankuchita, sankoch. There was a constriction of skin, but at the level of mass duct, there would be constriction of specific burn, that is specially ulcer, that means specially burnt area would be constricted. So these are the signs, symptoms of mass duct. What are the sira sanayu duct? What are the sign and symptoms? Site would be black colored, and site would have raised level. There would be no discharge. If there is a discharge, discharge will get stopped. So these are the three signs of sira sanayu duct. Other asti sandhigat, astigat and sandhigat duct features are dry site, and there would be site would be hard to touch, and all margins of that ulcer of that area would be erythematous. That means that will be red color. So these are the symptoms by which we can recognize whether it is twak duct, mass duct, sira sanayu duct, asti sandhi duct. So these are the signs. We should know it. In case of twak duct, we'll have to just switch it off. That means there is no need to move to mass duct. Twak duct means twak duct. Mass duct means mass duct. These two are the generally used duct, usually used in clinical practice. So what are the procedure? What we are going to do? There are three procedure series: Purv Karm, Pradhan Karm, and Paschat Karm. What are the Purv Karm? The person comes to us as just a raw person. Firstly, we'll have to explain the person verbally. That means what we are going to do. We are applying this red hot shalaka towards this area. That pain, your pain will be get rid of. That will be finished. There is just convince him verbally. Sometimes person does not convince by verbal communication. We'll have to show video also, previous patient videos also. That will raise the confidence. As I have shown few videos, your confidence may have raised. So by showing videos, the patient's confidence that will boost up. If it is boost up, that means he will ready to do it. Second, there should be consent. There should be pre-informed consent should be taken from patient, because persons, whenever we are doing good karmas, good Agnikarma, that means you are God to the patient. If you are not, there will be maybe some sort of error through your side or patient side, all mistake would be yours. The patient who would be considered as you as a God, he will consider you as a dacoit. That means dacoit. You have burnt his skin. So better to take consent, pre-informed consent. Whatever we are doing, each and every process would be done through following proper procedure ways. If there is something wrong happening in there, so there will be no responsible doctor. This is the normal consent being taken by all allopathic doctors whenever we get admitted at any nursing home. They just take it. So this is the very important concept for having this consent before starting treatment. In order to prevent from legal hassles, we'll have to have this consent, very essential. Third one is the Anpan. Patient should have full fed stomach. That means he should be given delicious food. Delicious means healthy food, having oily sort of, that should have snigdha ahar. Because some patients come without any having food, so these types of person may go to any sort of hypoglycemia also. They may have some vasovagal attack also. So better to have, patient should have fed with proper food. There are few indications where there is no need to give. The patient should be empty stomach. In case of ARSH, that means hemorrhoid. In case of Bhagandar, fistula. In case of abdominal pain, if we are doing any Agnikarma towards the abdominal pain, the patient should have empty stomach. So these are the clinical requirement for having food. Empty stomach, there are different. Maximum patient should have a full fed stomach. Fourth one is we'll have to search and mark tender points. It says that these are the tender points. He's having pain, specific pain is very excruciating pain. We'll have to just mark it with pen. After marking pen, we'll have to clean area with trifluquat. Trifluquat itself, that will clean the local area, that will destroy the all types of bacteria if it is there, if it is around the affected site. So this is the best best measures to get clean that specific area. We should wash it, and we should cover unnecessary exposed part of the patient. We should cover it. There is no need to expose unnecessary. We'll have to just cover it. Affected point that should be visible, and we should do Agnikarma over that area. That was Purkaram. Now this is Pradhan Karam. What we are going to do? We have to apply red hot chalaka over selected points. Selected points, that means most tender point. Second, few marks, few points are mentioned at our clinical text that specific disease we'll have to apply that chalaka at that specific point. So we'll have to select it firstly in the form of Valle, Bindu, line rubbing. These are the 4 shapes by we can do Agnikarmas. So I'm going to show video of Kativad.
आपको यहाँ जहाँ दर्द होता है ना, इधर इस एरिया में हाथ लगाओ, कहाँ दर्द है?
ये मेरे इस पार्ट से देखिए, ये यहाँ पर है।
ओके ओके,
बिल्कुल स्टिफनेस है और जुगनू से दर्द होता है, ये पार्ट।
ओके चलो ठीक है, तो वी आर गोइंग टू स्टार्ट नाउ।
ओके सर,
घबराना नहीं, बस बस बस, हिलना नहीं ज़्यादा। बस हो गया, फिनिश फिनिश फिनिश। बस हो गया, फिनिश। चलो हो गया। अब तो नहीं है दर्द? है दर्द? नहीं है,
लग रहा है हट जाएगा।
चलो अब आप मुझे बताओ, पहले आपका पेन हो रहा था, इधर मुंह करके बात करो।
हाँ जी,
घूम जाओ। पहले कमर में दर्द था, अभी आराम है या नहीं है?
बिल्कुल है, 100% है। और इनको लगाने के बाद, ट्रीटमेंट के बाद मुझे ना काफी रिलीफ महसूस हो रहा है।
किस चीज में रिलीफ है?
बैक पेन में।
बैक पेन के अलावा और क्या प्रॉब्लम है?
मुझे पहले शोल्डर का मेरा हुआ है। शोल्डर का मेरा, मैं ऐसे बैठ नहीं पा रहा था जैसे मैं बैठा हूँ अभी।
वो छोड़ो, इसका बताओ, इसमें पेन के अलावा और क्या तकलीफ में?
स्टिफनेस थी और वो अभी मैं खड़ा होकर झुकूंगा तब मुझे मालूम पड़ेगा।
एक बार करके दिखाओ, अभी देखो कितना रिलीफ है, पता चल जाएगा रिलीफ है या नहीं है।
बैठने से पता लग रहा है जी,
आराम है।
हाँ जी, रिलीफ है।
फिर भी आप बताओ, झुको जरा, झुकने से कुछ रिलीफ मिलता है?
झुक गया जी,
आराम है
बिल्कुल। मेरे तो ये लग गए, टच ही नहीं होते थे।
ओके, थैंक यू वेरी मच।
Now we will switch over to next PPT. What are the Paschat Karma? I am showing you video in between my PPT because this will give you a great confidence. Second, this will give you a great interest in this webinar also. Whenever we see movie, there's some sort of songs are being imbibed in that movie in order to raise, in order to make them awake, in order to make them more enjoyment. So I am trying to introduce this video in between this PPT. This will give you a great confidence and smiling face also. So whenever we are going to do Prashad Karma, what are the clinical requirement after Panch Karma, after this Agnikarma? We'll have to apply local application. Whenever this Agnikarma is over, we'll have to apply aloe vera. Aloe vera is easily available. This is shown also, it diagram also, photo also. Second one, that can be Madhyashti Grith. Madhyashti Grith means that increases the healing process also. So these are the two requirements for the sake of local application. After the Agnikarma, we'll have to counsel. Well, just check it out. After, we'll have to review the condition of that burnt area. If it is Twak Dag or Mas Dag, we'll have to check it out. If we are thinking to do Twak Dag and there may be some sort of error, you may cross the line, there may be Mas Dag also. So how, we'll have to check it out. We'll have to give treatment according to this Dag. Afterward, we'll have to check the scar marks. Scar marks give stress to patients, that ladies does not feel pain while having painful disorder, but they feel pain, they feel stressful condition after seeing this scar mark, because that creates trouble in their beauty also. So we'll have to convince him. We have to convince them that scar mark will vanish within the span of 4 to 5 days. In case of diabetes, where healing is delayed, it may take 10 days also, maximum 15 days also. So we'll have to just mitigate the stress of patient, that there is no need to worry about scar marks. It will vanish within 4 to 5 days. Scar mark is essential mark that should be happen in all case of Agnikarma. This is minute form that will vanish by itself with your healing power of the body. Whenever the patient goes back to his home, we should advise them that at home they should apply honey and grit over that burnt area, over that binduvat Agnikarma. So firstly, we'll have to check it out. How long will have to do this Agnikarma? Agnikarma duration, that depends on patient to patient also. We'll have to give 3 to 4 sessions also. I usually tell to my patients that you may require 4 to 5 sessions of Agnikarma. For all patients, I say, but maximum patients that get relief within 2 sessions also. If the patient will be mentally prepared that it will require to be done, 6 sessions would be required, he would be mentally prepared to come back to us. But the patient give relief, the patient gets relief within 2 sessions, then there is no need to do Agnikarma again. So in order to make them mentally prepared, so you have to say that 6 sitting would be there. So he would be mentally prepared. And site would be there, because there are few specified points for specific disease. We'll have to follow those specific points for specific disease. But if there is no site and no site has been mentioned, if you don't know any site, then best therapy, best IQ you have to apply. That means most tender point. You have to select it and apply Agnikarma Shalaka over there. What is the mechanism of action of Agnikarma? For Agnikarma, according to Ayurveda, there is no pain without Visheshan of Vata. And qualities of Agnikarma, you know very well that Ushn, Tikshn, Sukshm, Ashukari. These are opposite to Vata. That means if you are doing Agnikarma towards any patient having pain, qualities of Agnikarma will compensate the qualities of Vata. That means pain will be reduced. So second point, how does our inflammation get reduced? There is also mechanism of action, because for inflammation, there should be arm and cuff visheshan. That means cuff, dushti and involvement of arm is there. So here same matter plays important role. Virtues of Agnikarma are opposite to virtues of Kapha. So they play against and they play antagonist to each other. So there would be no inflammation. And second point, Agnikarma increases Dhatwagni. Dhatwagni means there would be Pachana of arm. If there is a Pachana of arm, that means there would be, because there are three types of Vata Vyadhi. There are three types of causes of Vata Vyadhi. Firstly is the degeneration, Kshay Janne. Second is the Avrod Janne. Third one is the Ubhyashit Janne. That means having two factors. So arm is creating Avrod. So if there is a Pachana of arm due to Agnikarma, heat, there would be no arm. If there is no arm, that means Avrod would be clear. There would be clearing of obstruction in the channels of Vata. Vata will move normally. If there is no obstruction means there would be no swelling along with pain. This is the mode of action through Ayurveda. So what are the modern view of action? There are four theories. Firstly is the gate control theory. Gate control theory, what does it say? Non-painful inputs like heat and touch. Heat means Agnikarma. Touch means if we are slapping to the person in great speed. So this is also hardened touch. So non-painful inputs that closes the gate of painful stimuli. Because the person is having pain. If you apply this non-painful input in the form of Agnikarma, so this will closes the gate of painful stimuli, which prevents pain traveling to central nervous system. That means pain will not be transferred to your central nervous system. There will be no perception of pain if you are doing Agnikarma. And there would be stimulation of non-painful inputs that will suppress pain. So these are the criteria of gate control therapy in which pain is subsided. So second is heat shock proteins. What are heat shock proteins? Actions of heat shock proteins are to repair proteins in the body. So Agnikarma, what does it do? Agnikarma that increases heat shock proteins, and heat shock proteins stimulates our reticuloendothelial system. Reticuloendothelial system that may lead to increased immunological response. So that will lead to helping in get rid of this disease. That means whenever immunological response will be increased, so it will help to get rid of disease and repair of tissues also. And there would be chances, there would be no further spread of disease. So heat shock proteins are very essential. So this shock proteins will be elevated by Agnikarmas. Agnikarma, if it is increased, that will help us to get rid of disease permanently. That will disintegrate the dosh dushya samurchana. Okay, so these are the second theory through modern view of action. Third one is the Sidney-Licht heat conduction theory. You know, as you already know, that pathway of pain and thermal signal. Thermal signal means Agnikarma. These run parallel to each other and in same area. They just end in same area. Stronger. Who would be stronger, that would be felt first by the body. If thermal signal, because Agnikarma is, we are giving Agnikarma through giving red hot shalaka, this would be very strong, that stronger would be felt first to the body. So if stronger is felt first, that means previous pain would be suppressed. This is also known as contralateral pain. The person comes to us that he says that I have a lot of pain in my back. If he says that, we just slap it. If the slap power is stronger, he will if we just pinch a needle to him, he will say that my pain is over. This is also known as contralateral pain. I will add one joke along with this mode of action. My patient came to me he came to me few years back. He was unmarried. He usually come to me, says that I have a lots of pain in my backache and lots of pain in my legs also. So whenever he comes to me, he says there is a lots of pain. So I was giving them some sort of panchakarma therapy, the other things also. So after a few months, he came back to me. He was very disturbed because he was married. He told me that I have no pain because my file is harassing me, giving me lots of trouble. So all types of pain have been vanished. So this is other pain. If it is stronger, that will suppress your physical pain also. So this is also known as contralateral pain. This was just a joke. Fourth one is the Van 't Hoff principle. Van 't Hoff principle. Here, cause of pain is accumulation of waste metabolites like urates. So Agnikarma, what does it do? It increases metabolic rate. If it is metabolic rate is being increased, that means there would be enhanced blood supply. If the blood supply is enhanced, that means requirement of oxygen and nutrients by tissues would be increased. So tissue will demand more oxygen and nutrients also. If there is a nutrition and oxygen nutrition would be there, oxygen is more, that means there would be expulsion of metabolic waste like urates. If there would be expulsion of metabolic urates, that will induce relief in pain. So because this is same theory works in our Avrojanye Vat Vyadi. We are clearing the passage of Vat channel because metabolic waste are creating obstruction in the passage of Vat. So there would be expulsion of metabolic waste. If it is clearing of this passage, that means there would be relief in pain and swelling. Next. There are few points to be kept in mind during Agnikarma. Very important points. Before starting Agnikarma, we should know about Marm Sthan, vital places. If there is a trauma over their vital places, that may lead to temporary to permanent disability also. That can induce death also. So we should know Marm Sthan. We should know the size and location of Marm Sthan before starting Agnikarma. What are the specified few marmas, special marmas we should know about it? Firstly is the Vidur Marm, Shank Marm, Vitap Marm, Sthapni Marm. These 4-5 types of marm are that needs to be known before starting this Agnikarma. So we should know it. So Shank, Sthapani, Vidur, Shipr, and Vitap. So these specified marms should be known to us. Afterward, we should check it out the bal. That means strength of the patient. Weak patient can be suitable for Agnikarma. Strong strength, that means looking bulky body, that can be weak for our Agnikarma. We'll have to check the mental strength of the patient. There are 3 types of bal: avar sattva, pravar sattva, pravar samyak sattva. So if the person is having avar sattva, that will create trouble because by seeing this red dot shalaka, that will create some sort of vasovagal attack also. There would have a overreactive responses also. So just check it out the bal of the patient, sattva of the patient, sar of the patient, sahanan of the patient. These are the 2 requirements to check it out before starting Agnikarma. We'll have to maintain the vitals also. Vital means BP, sugar, it should be normal level. The person comes to you with known case of blood pressure. At the moment whenever you are doing Agnikarma, the BP of the patient should be stable. And sugar should be stable. That should be at normal range. And what are the ritus? Sharad Ritu and Grishma Ritu. These are the 2 ritus in which we should not do Agnikarma because Grishma Ritu and there would be extreme hot that will increase your pitta, and Agnikarma is also Ushna quality. It is having Ushna quality that will also increase your pitta also. So patient will have a great sort of heat, burning sensation. In Sharad, Pit Prakop is there. there is heat. So these 2 seasons, we should not do Agnikarma. And we should know the specified points of Agnikarma where you have to apply this Shalaka. So we should know all types of Vyadhi with mentioned points where we'll have to use. What are the Agni Dagd types? These are the just theoretical part. Just I am going to give you a revision. Plusht. First one is the plusht one. There would be no burn. Only there would be skin discoloration. That is also known as tooth. Second one is durdagd. There would be blister with burning sensation, redness with piercing pain, and delayed healing. Third one is the atidagd. There would be hanging pieces of flesh. Patient will have fever, excessive thirst. A patient may go to syncope also. There may be destruction of Shira, Snayu, Sandhi, Asti, and there may be joint dislocation and delayed healing. And some make that means patient side will not be depressed and patient will have specified symptoms of Twag Dagd, Mas Dagd, whatever we are requiring to have. So Samyak Dagd is the best. We should try to give Samyak Dagd. This is the best one. Ati Dagd, that will create a wrong name to doctors also, or Ayurvedic fraternity also. So better to avoid all types of Ati Dagd, because we should know what are the levels of Agni Dagd. Firstly, these are the symptoms, we should know it. Samyak Dagd is the desired level of Dagd. What are the treatment of Dagd? Plusht. That we'll have to warm the affected portions with low flame. That means because there is no burnt area, only discoloration of site. So just warm it by putting warm cloth over that area. We can give oral administration of Ushun Virya like Haridra powder also. In case of Durdagd, we'll have to apply cold and hot Dravya over on alternate basis. Firstly, we'll have to apply cold Dravya and afterward hot Dravya. But we should keep one main point that we can apply Grit also, that should be cold. Grit is Shit by his nature. So it should be cold. If we are applying hot Grit, that will induce greater burning sensation, and this Durdagd will move to Atidagd. So always apply cold Grit, not hot. Samyak Dagd, what are the treatment? After Samyak Dagd, we'll have to apply honey and Grit or aloe vera gel or any eatable lime mixed with water. In case of Atidagd, we'll have to cut the burnt flesh, followed by application of Shali rice powder with Grit and cover it with Kamal Patra and apply Madhyashti Grit or Jatyadi Grit. Madhyashti Grit and Jatyadi Grit, that increases our healing. That decreases burning sensation. These are the 2 requirements of Agnikarma patients. They have to be concerned about burning sensation and healing. So these 2 Grit, apply it. That we can apply to all types of Samyak Dagd. We can apply Madhyashti Grit, Jatyadi Grit. So this will enhance the process of healing. So what are the advantages of Agnikarma? There is no need of medicine. After doing this Agnikarma, you just say to patient, there is no need to have medicine for pain. You just go there, go back to your home. If you feel some sort of pain or burning sensation would be there. After going through this Agnikarma, patient will not feel pain, but he may feel burning sensation. So burning sensation, for the sake of burning sensation, he can apply only Grit. That is available at every home, Desi Grit, Desi Ghee. This is very simple, safe and outdoor therapy that can be done at your home, that can be done at your clinic. So very economical. Aloe vera, Shalaka and LPG gas. These are the 3 things to be required to have. There is no need to hospital stay. Relief would be instant. There would be no bacteria. Because we are giving heat towards locally, we are giving heat locally over that area. Bacteria, if it will be, there would be bacteria that will get burnt. So there will be no chances of suppuration, no chances of infection. If there is no bacteria, that means healing would be faster. Healing is faster. No need to give anesthesia. Some doctors say, some patients say that can we give anesthesia? Because we don't want any pain after Agnikarma also. In case of corn, as usually being practiced by allopathic doctors, they give anesthesia towards corn area and just exile that corn and exile it and just apply bandage, and there will be chances of bleeding also. They just give some sort of pressure bandage would be there. But in case of Agnikarma, if we are giving anesthesia, we will not be able to judge whether dead tissue has been burnt or not, because after coming to know that patient feels pain, whenever patient feels pain, that means that area has been finished. Now live tissue burning has been started. So we'll have to just withdraw that shalaka. So this is the best moment, because dead tissue will not create any pain. So we'll have to just apply shalaka towards that corn. Patient feel pain, let's withdraw it and apply lime or lime water or any aloe vera. That will give you instant burning, instant relief in burning sensation. So there is no need to give anesthesia, no need to have anesthetist. There can be blood loss also, because whenever we have a foreign body, there can be, if there is a extra growth, there can be blood loss also. But in case of Agnikarma, that creates vasoconstriction. Vasoconstriction means if there is some sort of bleeding is there, if we are applying Agnikarma, blood loss will be finished. There will be no blood loss. So this is the benefit of Agnikarma. There would be no blood loss, because in case of corn, there would be the allopathic person, whenever they do, there it is the 100% there are chances of blood loss. We'll have to just pressure bandage over there. But in case of Agnikarma, there would be no blood loss. If it is there, that will get stopped. Relapse chances of any cosmetic origin of any disorder like corn, wart, mole, extra growth, there would be no chances of relapse. So these are the advantages of Agnikarma. What are the contraindications? Person is having uncontrolled hypertension, we should not do it. If the person comes back to us with controlled hypertension, we can do it. The person comes with uncontrolled diabetes. If the person comes with uncontrolled hypertension, if you are doing Agnikarma, what will happen? There would be hemorrhage. So better to not to do at that moment. Tell him go back. Tell him that patient to go back and have some treatment for hypertension. If it is stable, come back to me. In case of uncontrolled diabetes, if you do Agnikarma, there would be delayed healing. Marks would be delayed healing, and that would be healed after 1 month, after 15 days. So better to have stable, controlled blood sugar. In case of leprosy, atisar, we should not do it. In case of netra rog, ocular disease, we should not do it. But in case of vartam gat rog, that means paksham kop. In case of trichiasis, there would be eruptions of eyelashes in a different direction. That creates trouble to your conjunctiva. This is trichiasis. We can do it. We can have to burn that specified eyelashes. We'll have to burn that specified eyelashes by covering your eye with wet cloth. So in case of vartam gat rog, we can do, but other rog, netra rog, we should not do it. Pregnancy, we can do it in pregnancy also, but especially in lumbar spondylitis, we should not do it, because pregnant lady has to lie at stomach side. Okay, so whenever he's lie over stomach side, not with vertebral column, so that may lead to trouble in his infant also. So better to not to do to pregnant lady having lumbar spondylitis. If there is a foreign body imbibed and engulfed in that specific site, we should not do Agnikarma, because if we are doing Agnikarma, foreign body can move inside also. So just first extract that foreign body through any instrument or by a surgeon, we should do it. If there is a bleeding disorder, try to not to do. Bleeding disorder means thrombocytopenia and hemophilia. These are the bleeding disorder where Agnikarma is contraindicated. Weak patient and timid patient, on seeing red hot shalaka, they may go to neurogenic shock. they may go to vasovagal attack. So not to do. First, check it out the SAR, Sahanan, or these are the bulk of patients. If it is worthy to do it. Otherwise, don't do it. The person not suitable for sedation. That means person who is having their sedation means there is no fermentation is not required, or they're not suitable for fermentation. Pitta Vyadhi, person having Pitta Vikar, they are not suitable for sedation. We should not do Agnikarma. And we have already told you in Sharad and Grishma Ritu, September to October, May and June. These are the 4 months where we should not do Agnikarma. But in case of emergency, by maintaining the temperature of that room where we are doing Agnikarma, by regulating that temperature. But how can we regulate? By installing AC. The temperature of that specified room having cool ambience, that will give you a direction to give Agnikarma. Otherwise, without AC, without cooling ambience, that is very difficult to stabilize patient. Patient will have already having lot of heat. He may be experiencing a lot of burning sensation. So better to not to do. If he is in case of emergency, we can do it through installing AC in that specific room. These are the specified indications, specified sites for specific disease. In case of Vat Kantak, that means calcaneal spur. I have shown you videos also. So this is a site. इसको हटाना है रितम मन्याशूल को, ये ना हटाओ. Just a moment. अच्छा चलो छोड़ो, कोई बात नहीं. I will tell in same lyric. छोड़ दो. In case of firstly, जल्दी करो. क्या कर रहे हो? In case of Manyashul means cervical pain. What are the specified spots, specified sites where we have to employ this Agnikarma? Whenever there is a prominence of muscle, because in case of cervical spondylitis, there would be prominence of muscles. So we'll have to just check it out, the prominence of this muscles, elevated area of the muscles. We'll have to do Agnikarma over that specified points. In case of Vat Kantak, we have to do Agnikarma 2 fingers above Shipramarm. That means Shipramarm is very dangerous marm. That means if you are hurting Shipramarm, that may lead to convulsions also. So we'll have to just apply that Shalaka 2 fingers above the Shipramarm or most tender point. These are the 2 sites for Vat Kantak. In case of Gridrasi, Sciatica, 4 finger above Janusandhi on lateral side of thigh. In case of hepatic disorder, medial side of the right elbow, not at the joint. Joint means elbow marm. So this there would be also a specified marm. So we should not do it Agnikarma at that joint, but below or above. That means medial side of the right elbow, we should do it. In case of splenic disorder, in case of hepatic, right elbow. In case of splenic, that should be at left elbow. Left for splenic. Okay, the same sides, but right and left. In case of cervical or axillary lymphadenitis, that is also known as Apache, 2 finger below Indrabasti marm. Indrabasti marm is very important. That is usually involved for your Agni. If it is disturbed, that may lead to metabolic disorder also. That may lead to bleeding disorder also. So very essential to not to get hurt this Indrabasti marm. Very dangerous marm. So 2 finger below. So that's why I'm telling to you that we should know marm, all marms, location, size of marms before starting this Agnikarma. In case of Kativat, in case of Manyashul, in case of Kativat, same thing. That means muscular prominence in lumbar region, lateral to lumbar, vertical in between L1 to L2 or L2 to L3. That means if the patient feels pain in between L1 to L2, we'll have to mark those muscular prominence area and apply Agnikarma Shalaka. If the patient feels pain in the area of L2 to L3, we'll have to apply that specific area. If the patient will feel at L4 to L5, we'll have to apply that Shalaka towards the tender point. So depends on the condition, depends on the statement of the patient where he is feeling pain. In case of Janu Shul, 4 finger below or above, knee crease on lateral side. Janu Marm, knee crease. So we'll have to just slave our Janu Marm. We'll have to apply this Shalaka 4 finger above or below, not at knee crease, okay, on lateral side. Though these are the few indications. I can't cover all indications. These are the just examples for which we should take care of all specific sites for Agnikarma. So I would like to share my experience by discussing these case studies. Patient came to me. He was 72 years old. He came to me. Generally, calcaneals for patients
I'm
get
constantly
relief in
there, so
4.
kindly, Ravi ji.
हाँ जी.
Time, थोड़ा time.
शॉर्ट में करें सर.
यहाँ 1.5 घंटा हो चुका है.
सर बस शॉर्ट में कर रहे हैं. मैं आप केस स्टडीज के बारे में कुछ नहीं बोलूंगा, या ऑलरेडी बता चुके हैं. नेक्स्ट
बिल्कुल बोलना चाहिए. आप बहुत अच्छा बोल रहे हैं, इसलिए टोकने का सवाल ही नहीं है. आई एम सॉरी.
बोलूं कि नहीं बोलूं सर?
बोलिए बिल्कुल.
सर ये दो इंपॉर्टेंट है, इसलिए लोगों को इंटरेस्ट भी रहेगा.
जरूर. ये
अच्छा,
हम
मैं
लोगों
कहना
के
चाह
लिए
रहा था
पूरा
कि
सीखने की बात है.
शॉर्ट में बताऊंगा
फॉर
सर.
शेयरिंग.
ओके, calcaneals फर में जो 72 years का पेशेंट, he came to me, that relief was he got relief in 6 sittings. Some patients get relief in 4 sittings, 3 sittings, depends on the patient condition also, age of the patient, few other factors, they play important role. So I would like to show a corn video, this one. This will give you a relief. This will give you an idea. That tissue, patient is not having pain because we are applying this red hot. Whenever he feel pain, we just withdraw it. Patient has told me that he is feeling pain, just withdraw it and apply this cool lime paste. This will give instant relief in burning sensation. Just move it. आगे करो. दूसरा दिखाओ. This is the other case of corn. I will show it in short time.
कर दिया.
This see just black point. This is the area of corn. We're just applying Shalaka over that area. Smoke is there. You may be seeing. No pain. Or we'll just apply cool lime over there. Just next. I would like to show this wart also. These are the wart. This is my wart condition that was in axial. That is being done by my guru. He did it. I experienced that pain. That's why I come. Pain is being perceived by patient. We should know about the pain also.
दिसतंय ना सगळं? नाही पण दिसतंय चालू आहे रे. आकडे चालू झाले ना वरती. हां, बंद पडले पण ते आकडे. परत दाब मग. हां, चालू आहे आकडे चालू आहे. शूटिंग चालू आहे.
Finish. Next. Just keep it early. Next. What are the limitations? In case of fracture, soft tissue injury, ligament injury, tendon injury, we should not do it. If we say that this is charismatic technique, if it is boon for all types of disorder, but it is not the same. We should know the limitation of Agnikarma. Because in case of fracture, we should not do it. We can't do it. no relief in pain. That will enhance the pain also. Try to not to do in fracture, soft tissue injury, ligament injury, tendon injury. The patient comes to us with pain due to tendon injury. Just refuse them that we can't give relief pain in through Agnikarma. So directly refuse them. If you will directly refuse, that will save your condition, save your reputation also. In case of degenerative disorder, that means in case of Janu Sandhigat Vat, we can't stop degeneration. We can just delay the degeneration. We can't, in case of degenerative disorder, pain would be there. If you will do, we feel pain would be there, but relief would be there within the span of 3 sittings. If the patient gets relief in 1 sitting, tell them that this relief is for temporary base, because we can't renew your cartilage, which is being which is degenerated in case of Janu Sandhigat Vat. We are helping you to get rid of your analgesics, because the person does not get pain relieving medicines. That means he is saving himself from gastric upset, renal disorder, and by having Agnikarma without any medicine, he is having pain relief. So this is the boon, this is the benefit of Agnikarma without any medicine. But we should just convince the patient that this relief would be temporary. In case that Agnikarma is not effective in Sanchayavastha of dosh, there are the 5 procedures, 5 karmas of Sanchay, Prasar, no, these are the 5. But it is effective in Prasar Bhedavastha. That means Prasar Bhedavastha, it is effective in Agnikarma, is mostly effective in Prasar and Bhedavastha. So not effective in Sanchayavastha. I am just giving it in hurry. Okay. What are the, now we will conclude. Instant pain and relief in stiffness, no need of analgesic, no side effect. So we should have theoretical and practical exposure before starting Agnikarma. It is boon for painful society. So my request to all of you who are listening, who are new to this Agnikarma, they should start Agnikarma at their OPD level. Thank you. Now I am giving to you Dr. Pawan Sharma ji.
Thank you, Ravi ji. बहुत धन्यवाद. आपने, you have given us a lot of details and you have kept everybody completely glued to the screen, learning from you and from your experience. I particularly liked your explanation, mechanism of action of Agnikarma. Pavanji may tell us how much more time we have, but I open the floor for our...
No, not open, sir. First speaker is left.
Okay, Pavanji, please.
So I would like to request excellent, first of all, excellent Dr. Gogia. Excellent.
Thank you,
really,
sir.
it was mesmerizing, number 1. Learning experience, number 2. Though we can't do this Agnikarma on our patient, but definitely it will inspire us, and definitely we will also try to incorporate this in our strategy whenever and wherever it will be needed. Thank you.
Sir.
Thank you, Dr. Ravi. Thank you very much. So nicely explained that every point and every aspect is clear. Excellent. So
Thank
now
you,
I would like to request again Dr. Umendra ji, Dr. Umendra Singh.
Ravi ji, please stay with us because there will be questions after this.
Yeah, I'm there.
Thank you.
Dr. Umendra. Dr. Umendra Singh ji, yes, welcome.
Yes, sir. सर वीडियो शेयर करिए आप, मैंने आपको भेजे थे वो। कहाँ से आए? अच्छा, क्या दिक्कत थी? अच्छा। ये आर्सेनिक सूल वाला पेशेंट था, एडी में दर्द था इसके पीछे की तरफ। लगभग 4 महीने से ये परेशान थे, इनके पेन के साथ में स्वेलिंग भी थी हल्की। तो एलोपैथ में दिखाया इन्होंने, तो वहाँ उनको रेफर कर दिया था। 3-4 महीने तक लगातार ट्रीटमेंट किया लेकिन सक्सेस नहीं हुआ, और उसके बाद ये हमारे पास आए थे। हमने इनको अग्निकर्म किया था, देखिए आप।
बस हो गया ये लो, अब देखो देख सारा दर्द दूर हो गया।
ये इनके किया था अग्निकर्म। उसके बाद में इनका रिव्यू आप देखेंगे तो इनको ये बता रहे थे कि लगभग ऑलमोस्ट पेन है वो दूर चला गया।
बस ये इतनी सी बीमारी 6 महीने
2
से
सिटिंग में इनके मतलब टोटली पेन दूर हो गया था, और कुछ हमने मेडिसिन दी थी। जी सर, कट कर दें इसको, बस ये कंप्लीट हो गया। नेक्स्ट वीडियो चालू कर दें।
आपका नाम है? कहाँ से
इनका
आए?
रिव्यू है।
अच्छा अच्छा, क्या दिक्कत थी?
ये देखिए चेहरे पे इनकी मुस्कान से आप पहचान सकते हैं इनको कितना आराम है।
कितने दिन से? अच्छा, कितने दिन से?
4 महीना होगा।
4 महीने हो गए। अब कैसा लग रहा है आपको?
अभी देखो ये दर्द
अब दर्द नहीं है बिल्कुल ही? अच्छा अच्छा, ठीक है। तो अब आप एक बार और आना है ना,
क्यों आराम है
इसको और सही कर देंगे।
ठीक सर, ये नेक्स्ट वीडियो ले लें सर। ये पार्श्वनिक सूल वाला हो गया था अपने। ये बैक पेन का पेशेंट था, साइटी का नहीं है इनको, लेकिन कमर में दर्द लगातार रह रहा था इनको। ये देखिए इनको बिल्कुल फील नहीं हो रहा है, मतलब ट्रिगर पॉइंट अपन एग्जैक्ट पता कर लेते हैं तो वहां पे इनको पता भी नहीं चलेगा। गर्म सलाखा वहां पे लगेगी लेकिन इनको पता भी नहीं चल पाता है।
बस हो गया,
ये कंप्लीट हो गया सर इनके। इनकी नेक्स्ट वीडियो ले लें। ये इनका अग्निकर्म कंप्लीट हो गया।
झुक के देखो तो कहाँ पे दर्द
रिव्यू
होता
देखते
है,
हैं।
दर्द हो रहा है कि नहीं हो रहा? नहीं इधर बिल्कुल ही।
इनको हमने अग्निकर्म के बाद में एलोवेरा लगा करके और पट्टी की है। ये आराम से आगे पीछे की तरफ झुका है।
पहले आगे मुंडे पे होता था, पीछे मुंडे पे होता था। आगे मुंडे पे, आगे मुंडे पे नहीं हो रहा। ठीक है, कितना आराम है लगभग?
आराम से
80 पैसे आराम है। ठीक है, तो 20 पैसे भी चला जाएगा ना।
लगभग 80% इनको आराम हो गया फर्स्ट सीटिंग में।
ये 10-12 साल से 10-12।
ठीक सर, नेक्स्ट वीडियो ले लें। ये कंप्लीट है।
आराम से रिलैक्स लेट जाओ।
ये नी पेन का पेशेंट है, लेडी पेशेंट है।
थोड़ा सा होगा, बाद में ये नसें जो चढ़ रही है ना, ये सब दूर हो जाएगी। इसको ढीला छोड़ दो, एकदम ढीला छोड़ दो।
ये पैर इनका पूरा मुड़ नहीं पाता था, नीचे बैठ नहीं पाते थे उकड़ू हो करके। ये अग्निकर्म के बाद में आराम से पूरा पैर इनका फोल्ड हो चुके हैं।
हो गया, अब थोड़े हो रहा है दर्द।
साथ में कुछ हमने मेडिसिन दी थी इनको।
जी बोलिए।
नहीं, कंप्लीट हो गया।
उमेंद्र जी बोलिए।
हाँ यस सर।
थैंक यू उमेंद्र जी। आपका और उमेंद्र जी, हैव यू फिनिश्ड? खत्म?
यस सर,
शाबाश।
तो वीडियो और है लेकिन अब टाइम नहीं है तो कोई दिक्कत नहीं, लगभग अपना ऑलमोस्ट कंप्लीट हो गया।
शाबाश। हमारी तरफ से एक सवाल है आप दोनों के लिए, ये
Yes,
जो इसकी हीटिंग कैसे करते हो आप? ये जो
हीटिंग सर, ये गैस पे गर्म करते हैं सर, क्योंकि
अच्छा।
इसकी लो है वो ब्लू होनी चाहिए, अपन मोमबत्ती से नहीं कर सकते।
अच्छा।
यस सर, मोमबत्ती से करेंगे तो उस पे कार्बन आ जाएगा, तो प्रॉपर अग्निकर्म हो नहीं पाएगा, सम्यक दग्ध नहीं हो पाएगा, इसलिए हम इसके लिए ब्लू लो चाहिए, तो हम गैस पे ही गर्म करते हैं।
हमारे साथ आज काफी जने थे और अभी है हमारे साथ काफी लोग। So पवन जी, can I open the floor to our audience?
Definitely, if any question is there, anybody can ask.
Please, so the floor is open, क्योंकि हमारी तरफ से एक दो सवाल और है। I want to thank Ravi ji for giving mechanism. आपने से वो जो सोच जो आपने बताया रवि जी, कि लगाने से कफ की इफेक्ट, कफ के ऊपर जो इफेक्ट है, दैट्स अ वेरी स्पेशल थिंकिंग। उसके बारे में थोड़ा सा और बताना जी, कि जब व्हेन यू पुट दिस इंस्ट्रूमेंट और कफ के ऊपर इफेक्ट जो आपने बताया, उसके ऊपर थोड़ा और बताना जी, इस सोच के ऊपर। अनम्यूट कर दीजिए रवि जी, अनम्यूट।
Because cuff is having quality that are different from your Agnikarma. Due to Agnikarma qualities, Ushn, Tishn, Sukshma, Ashukari, that is antagonist to the qualities of Kapha. So that destroys that compensate the qualities of Kapha. So this is the reason why we are having this relief in pain and swelling due to Kapha Dushti. Because whenever there would be Kapha, there would be Am also. Because Agnikarma increases Dhatva Agni also, that will inspire digestion of Ama, so which is the main factor for your any type of pain and swelling. So if there is a digestion of Kapha, that means there would be clear passage of Vata. That means if the Vata is roaming in the body without any hindrance, without any obstruction, that means there would be no pain. So Kapha Dushti and Vata Dushti, these are the two Dushtis for which Agnikarma plays an important role.
Ravi ji, I have another question. Isme, have you seen any non-responders? Just matlab where you have tried Agnikarma, but the patient is not responding. उसके बारे में थोड़ा बताना जी, क्योंकि और दूसरी चीज इसमें कुछ adverse effect होती है कि नहीं, उसके बारे में।
Sir, for the last few years I am practicing this Agnikarma. I have not seen single patient who did not get respond to Agnikarma. He will have response in pain relief within the span of few seconds. But there is no single patient who told me that there is no response, because there would be pain sensation would be there in live body. If you are doing thermal signal or if you are giving thermal signal, the patient will respond. Thermal signal, that these are more stronger signals given to CNS of the patient. The patient will get response 100%. There is no single patient having this. There is no response in pain relief. Second, adverse effect. There are, if the patient or if the error of the patient is there or doctor's negligence is there can be overdagd, ati dagd also. So that can create trouble to patient and doctors also. That can create trouble to his reputation of doctor also. So we should be very careful that dagd should not be overdagd, ati dagd. So samyak dagd, we should take care about samyak dagd. If it is samyak dagd, there is no chances of any ati dagd, any side effect. So this is the 100% sure patient will get a response if the patient is live.
Thank you, Ravi ji. I want to open the floor. हमारे साथ है शुभदीप जी, शायद आपके कुछ सवाल।
हाँ सर, आपके जो क्वेश्चन है उसका जवाब है मेरे पास। आपने जो कहा कि रिस्पांस नहीं हुआ या फिर कुछ एडवर्स इफेक्ट हो गया, 2-3 दिन पहले ही जैसे सर ने अभी स्लाइड शेयर किया था, उसमें बताया कि कहाँ कहाँ पर हमको अभी कम नहीं करना चाहिए। उसमें एक लिगामेंट इंजुरी, टेंडन इंजुरी, इस टाइप के कुछ पॉइंट्स थे। तो कहते हैं ना कि पूरा ज्ञान होना चाहिए, आधा ज्ञान होना चाहिए। तो मैंने बात समझ कर मैंने उस पर अग्निकर्म किया था, तो वो पेन काफी बढ़ गया था।
शुभदीप जी, आपका आवाज कट रहा है जी, थोड़ा सा आवाज। थैंक यू शुभदीप जी। हमारे साथ है सेनका कोडिकारा। Senaka, I think you are joining us from Sri Lanka. Senaka? No, Senaka. Senaka, hello. Tell us a little bit about yourself, please.
I'm Dr. Senaka Kodikara. I'm joined in Sri Lanka, and I'm living in Gampaha. And I'm BMS basic degree holder. Nowadays I have working in Department of IRES as a media coordinating officer and as a doctor in Gampaha Agnikarma Teaching Hospital. And very important lecture in this one. I'm like to teach in the Agnikarma.
Senaka, where did you do your BAMS? In India or in Sri Lanka?
In Sri Lanka.
Where did you study? In Colombo?
Yes, sir.
Okay, good. We are very happy that you have joined us today. You can see we have experts here. Ravi is here from Delhi, who will be happy to have you as a visitor to come and learn the technique. So
yeah. I also happy to join with you, sir. And we learn a lot of things these sessions, and we will hope to get the new lecture after some get to your experience other reliable topics in our postgraduate degree.
Thank you. Senaka, could you do, I don't know if you are able to put your contact details in the chat box so that we can have your details. Number one, either a WhatsApp number or an email or both would be nice. Okay. Number two, we would like you to continue to join us in our programs, in future programs, because we have
definitely, sir.
Pavan Sharma ji is organizing so many webinars, and there will be many that you will find very exciting. So we invite you to be a part of this team and be a part of the group that is organizing the event. So we'll be grateful to have you with us. Please share your contact details, a WhatsApp number and an email address on the chat box so that anybody can get in touch with you. If you would like to comment, if you have to add a few more comments, the floor is yours. Otherwise, I want to invite, I think Harish ji is joining us from Toronto in Canada, and he might have some comments too. So, Senaka, if you have no more comments, can I pass the floor to Harish ji? Harish ji, namaskar.
Sir. So, Dr. Ravi ji, thank you very much for sharing your knowledge. It was very wonderful presentation, and you have wide experience. Congratulations. Now, I have 2-3 questions. First of all, have you seen there is a relapse of symptoms after Agnikarma?
In case of degenerative disorder, there is a relapse because we can't stop. In case of osteoarthritis of knee joint, because there is a degeneration of cartilage, we can't regenerate also. So temporarily pain would be subsided. Then after session is there, after session is completed, after 10 days, he comes to me that he'll say that pain is still there. Pain, whenever we did it, Agnikarma, pain was vanished. But after 10 days, it has been relapsed. So if we are giving, if we are inhibiting intake of analgesic drugs for 10 days, that is also a best criteria to have a best response, that patient is free from all medicines, no side effect from our analgesics. That means he is free from analgesic, but there are chances of relapses in case of degenerative disorder. In case of avroch janneva, that means where there is obstruction in channel of vata, if the passage, if the obstruction is clear, that means patient relapse chances would be very less. In case of cosmetic condition, just like corn, wart, extra growth, and keloid, there are negligible chances of relapse. But in case of painful disorder, degenerative disorder, that may come back. But there is a chances of relief temporary to permanent. Depends on the patient condition, also depends on the duration of the disease, how long he is having this disease. So depends on the patient to patient. But the patient comes to me at the age of 72, he says that he's having pain due to osteoarthritis of knee joint. There will be relief in pain, but he will come back, because we can't stop, we can't stop degeneration. This is the process by which we can say relapse is there in case of degenerative disorder only.
So I have two more questions.
Okay.
Second question is, have you ever tried this Agnikarma in cardiac disorders, particularly angina pectoris or myocardial infarction, acute myocardial infarction? Have you ever tried?
I have not tried. This is not mentioned in our books that we should do it, because the pathology of cardiac pain is different. We can't help. So I have not tried over that cardiac area. We have not tried it. I would advise that we should not do it. We should have pain relief through bone and joint disorder only. Connective tissue disorder, pain originated through connective tissue disorder can be helpful. Agnikarma can be helpful, but the sake of cardiac pain, it is not helpful. It should not be done.
Okay. And how you think, how you compare it with the diathermy, whether it is a better technique than diathermy or it's equivalent to diathermy, modern diathermy?
Diathermy, it is usually used by allopathic persons. They are using it for whenever there is a bleeding disorder, bleeding is there, they will use as a diathermy. They will stop that bleeding, but they are not using for pain relief. Diathermy.
No, diathermy they are applying in various conditions. Diathermy has various applications. It's also used in bleeding disorder as a cautery diathermy, and it is also used for musculoskeletal pains.
Okay, I have not heard about the.
Even the nowadays the physiotherapists use the ultrasound diathermy or ultrasound methods to relieve the pain. There are a lot of modern equipments and technologies are available now to relieve the pain only. But the question is, and last question to you is, sir, do you use certain medicines also with your therapy?
Sir, I am not using any medicine along with my Agnikarma. I am just giving this therapy alone. Second, Agnikarma plays an important role while rendering this pain relief. It is stronger. It will give stronger relief rather than diathermy, because the patient comes back to us that we are doing a diathermy from physiotherapy, but we are not getting response. We are giving Agnikarma to those patients. The patient says that we are having great sort of relief and relapse is there, but it may be 15 days back. 15 days back it would be there, but relief is more found in case of Agnikarma rather than having diathermy procedures.
So is there any harm if you use medicines, particularly in degenerative disorders, like you are talking about osteoarthritis, cervical spondylitis, or lumbar spondylitis, or sciatica even, because pathology is in the blood, in the system. So unless and until we treat the pathology, we can't cure the patient. So is it wise to incorporate medicines along with this procedure?
we can incorporate medicine along with this Agnikarma. Patient comes to us with pain, for pain. Patient, if the patient doesn't have pain, he will not come to us. If the patient feels pain, if we are giving relief in pain, without medicine, he is better to have without medicine. But medicine are a very essential tool to give cure to this ailment. It is advisable to have medicine, but the patient is having no pain, he can avoid it. We can give Ayurvedic medicine or whatever medicine is requiring, but patient is having no pain, there is no need. Otherwise, for the curing of this disease factor, we can give medicine also.
Okay, sir. Thank you, sir. Thank you.
Thank you.
And
Thank you,
over to
Harish ji.
God.
Thank you for aapke, Harish ji, did you have a reason for asking the special questions? Degenerative conditions?
Yes.
As Ravi ji says, it's a difficult one. And I think Harish ji ki taraf se shayad ye sawal hai, could we improve the health of the tissue with some rasayanas or something? I don't know if that is what you had in mind.
Yes, sir.
And
but today, I got a good idea from Dr. Ravi ji that Agni can be treated locally also. That's a wonderful information I got. Because I listened him very carefully. So it's a wonderful idea. If there is a blockage due to AMA, we can treat AMA with the local application of Agni. That is why I asked the question, in cases of angina pectoris, can we use Agnikarma? Maybe the mild Agnikarma. It can be tried. Maybe mild but the local AMA can be treated with Agnikarma. This is a wonderful information. Thank you, sir. Thank you.
Thank you, Harish ji. Thank you. Your
I would like to add, sir, I
Please.
would like to add one thing. As Harish ji told, he just inquired about the Agnikarma scope in case of cardiac pain. Whenever we are giving sedation, that means fomentation. So fomentation towards our inguinal area, cardiac area, that should not be done, as we are reading in our classical texts also. Because Agnikarma is having some heating effect. So we are applying towards the cardiac area with heating effect. So that is not advisable to do Agnikarma over that area. So better to not to do. If it is, you are saying that if it is mild form, that will not work. So better to have treatment through cardiologist rather than Agnikarma. We should know the limitation also. That is not applicable to all types of painful disorder. We should know tendon injury is there. We should just refuse it. Cardiac pain is there, refuse it. So we should have a practical approach.
Thank you. Thank you, Ravi ji. There are some questions coming. Aapke thoda aur, our people want to know a little more about yourself. Aapne kahan padha, aapke Ayurved or specialization, aapke Guruji ke baare mein to aapne bata diya. Thoda aur, agar very quickly. Just...
Sir, short mein, I did my BMS from Rohtak. And
Achha.
after completing BMS from Rohtak, I did PG from Odisha. Gopabandhu Ayurved Mahavidyalaya, government college. That I did in Kai Chikitsa, that means medicine side. But at third year of my PG life, some senior from surgical side, he told me that he's going to learn Agnikarma from Jaipur. So I was very enthusiastic to learn new thing, but Agnikarma belongs to surgical side. So I was just apprehensive whether should I learn it or not, whether the person, my head HOD will allow me to go there or not. I was just apprehensive. After completing this, my PG, whenever I came back to my hometown and joined MCD services as a Panchkarma hospital, I realized that there should be some sort of pain relief through Ayurveda also, because each and every doctor says, my HOD used to say that we are having lacuna to combat this pain through medicine. We can't give so much pain relief in Ayurveda through medicine only. We are having lacuna. So we should have something new. So when I knew about Agnikarma giving instant relief, so I was very enthusiastic. I just thought to learn it. I went to Maharashtra and learned it from there a few years back, and just that knowledge gives me a unique personality. That knowledge gives me a power to remain in my Kaya Chikitsa stream, but having power tools to combat this combat this painful stimuli through Agnikarma. This is a very unique quality which I have earned it. I am very thankful to my Guruji, Dr. Narendra Gujarati ji, Dr. Uday Talar. I am so much grateful. So I have learned it. So I would advise all people who are new to this, they should learn it. And they will break their wrong notion that Ayurveda works late. It is a very fast acting medicine, fast acting technique without no need of medicine. So this works very miraculously.
Thank you. रवि जी, एक और सवाल कि रोहतक में 2 कॉलेज है आयुर्वेद की, बाबा
I
मसना।
did my PG BMS from this was God College. In 96, I passed my BMS in 96.
Thank you. Thank you, Ji. Thank you. This intervention, the term that is used here for this kind of intervention is called non-pharmacological intervention. So this is one thing. I'll just put this up on the screen here. और यहाँ पे Montpellier, University of Montpellier, France में जी, this is the oldest medical university in Europe. वहाँ से Professor साहब Gregory Nino has written ये किताब non-pharmacological interventions, and this is a very important area of that is starting to gain more traction. More people want to learn these non-pharmacological interventions, and what you have given us today is a very important point. What you and Umendra ji have shown today are very important points. And as Harish ji says, for me, that was very exciting, ki you are talking about local AMA and management of localized AMA is your model. Or शायद अग्निहोत्री जी भी है हमारे साथ. If somebody in the audience wants to comment a little bit on this local AMA, how does local AMA accumulate? इसके ऊपर, I don't know if there is something written in the Samhitas about localized AMA and how it accumulates and how it leads to complications. शायद आपके पास कुछ होगा रवि जी.
हाँ, sir. AMA is that is generated due to weak digestive fire. Whenever there is a weak digestive fire, so there will be generation of AMA that will move towards all types of joints.
Achha.
Whether it is local or systemic, you are seeing as a local because it is not local, that is generated through generalized way. So AMA is generated due to weak digestive fire. Firstly, you have to correct weak digestive fire. That will increase the digestive fire, Jathagni. That will digest the AMA, whether it is local or systemic. So this is not local. So all types of local that generates from systemic. So firstly, increase the Agni.
Thank you. Shahid, Raviji, I think this is maybe perhaps one of the questions Harish ji had to ask, whether there will be some relief if these patients who come with localized pain you are treating, whether they can get some relief by some formulation that will improve Jataragni and the whole systemic Agni, whether that, I don't know if this is what Harish ji had in mind as the second part of his question.
Yes, sir, it covers under Srota
Srota.
Yeah. So if there is a local Srota Avrodh, particularly if there is a wound or a ulcer, Dr. Raviji, can it help in wound healing also?
Sir, as per our mode of action through allopathic way, that is heat shock proteins that stimulates our Agni. If that stimulates our Agni, that stimulates our reticuloendothelial system also. That will increase our immunological response, leading to speedy healing also. That will prevent to have further spread of the disease also. So as per allopathic way, this is also mentioned, but as Ayurvedic way, it can be helpful if you are increasing the Agni, Dhatu Agni and Twacha Agni. If it is, whenever we are giving Agni through Agnikarma red dot Shalaka, that means the specified areas Agni that will get enhanced. If it is get enhanced, that there would be more supply of blood, that means there would be demand of oxygen, nutrients would be more, there would be oxygen and nutrient would be there. That means there would be enhanced healing also. So it is helpful for healing also.
Sir, there is one last question, very important question. Have you ever noticed there is any systemic change after Agnikarma?
Systemic change in case of Avrodhjanya Vyadhi, whenever there is obstruction in the passage in the channels, so whenever we are creating the clearance of this passage, that means the pathology of this painful stimuli, pathology of the painful condition, that will be finished. So we will have a cure of the disease.
So have you ever
this is
seen
systemic change.
Have you ever seen in your patient that
I have seen few patients who is having blockage in their passage of their Vata channel. So by introducing Agnikarma towards that specific point, they got relief through permanent way.
Thank you.
Very good.
Thank you, Raviji. I think this is a very important and a slightly deep question that will require a little more time to. इसमें criteria क्या है, लक्षण क्या है, शायद उस तरफ जानी है discussion.
उसके लिए we'll have to prove it through objective parameter also.
हाँ जी, बिल्कुल, बिल्कुल. I just want, before I push, उमेंद्र जी, शायद आपकी तरफ से कुछ हो तो please, the floor is yours, उमेंद्र जी, क्योंकि 8:45 हो गया time. We're coming. We have another 5. उमेंद्र जी, शायद आपकी तरफ से कुछ हो आज की चर्चा के ऊपर, please.
हाँ सर, लगभग कंप्लीट, ऑलमोस्ट बस कहना चाह रहा हूँ, उसमें सिस्टमिक को होता है, स्थानिक कोई भी प्रॉब्लम होती है तो उसमें तो अग्निकर्म टोटली 100% वर्क कर जाता है, लेकिन जब सिस्टमिक तो उसके लिए फिर मेडिसिन की जरूरत पड़ती है। जैसे कोई भी डिजेनरेटिव स्टेज है तो उसमें अग्निकर्म के साथ में मेडिसिन की जरूरत पड़ती है, तो वो कंप्लीटली क्योर हो पाता है।
उमेंद्र जी, आपसे भी एक ही सवाल हमारी तरफ से कि ये आपने BAMS कहाँ करके अग्निकर्म की तरफ कैसे आया?
सर मैंने BAMS उदयपुर से किया है।
अच्छा जी,
उदयपुर राजस्थान से।
हाँ जी।
और अग्निकर्म मैंने अभी ये पंचकर्म का एक कोर्स था ऑनलाइन,
अच्छा,
ये कोविड के टाइम पे तब हमने किया था, तो वहां से मेरा अग्निकर्म स्टार्ट किया है। अभी 1 साल हुआ है तो अभी मैंने स्टार्ट किया है।
थैंक यू उमेंद्र जी। आज की जो चर्चा के ऊपर कुछ और अगर हो आपकी तरफ से फिर प्लीज कमेंट।
नो सर, ऑलमोस्ट कंप्लीट सर।
ओके, थैंक यू सो मच, थैंक यू फॉर बीइंग विद अस टुडे। रवि जी, उमेंद्र जी, प्लीज जोड़ते रहिए जी हमारे प्रोग्राम की, इसकी यू आर आवर गाइड फॉर द फ्यूचर प्रोग्राम्स। बिफोर आई so please join and guide us in the program for the future programs. Pavanji will keep inviting and sharing a lot of information. You are part of the team now because you have made very, very valuable presentations today. And we look forward to having you with us in future events to make this network stronger and to strengthen. Ravi ji, Umendra ji, aapki taraf se agar थोड़ा और रिसर्च की तरफ जाना हो तो डू यू हैव एनी कमेंट्स, सजेशंस? कि आजकल लोग बात कहते हैं कि रिसर्च करो भाई इसके ऊपर, रिसर्च, मॉडर्न टेक्निक्स, मॉडर्न असेसमेंट टेक्निक्स लगा के थोड़ा रिसर्च। आपके मन में कुछ हो प्लीज रवि जी, शायद आपके मन में होगा काफी कुछ लगता।
सर, it should be, there should be great research on Agnikarma because before treatment what was the scale of pain and after treatment what was the scale of pain. So we should judge it and compare it. We can prove our efficacy of this Agnikarma to all people, all unknown person or any research ethical committee by our this research oriented objective parameter. If it is completing all through parameter, that will be more visible and more efficacious to while proving our point to the research person also. So we should have a research body while having objective parameter through pain measuring scales also.
I think Agnihotri ji will comment on this, but before I put we are coming, as I said, we are almost 15 minutes. We will try and finish this, but before I give the floor back to Pavan ji to taking the program onwards, I'm taking the liberty of sharing 1 or 2 slides. Yeah, okay. And this is my first slide here. Ki what you have shown us today, both of you have shown us today, there is a deep neurological basis for this. You have given us pointers to where that answer will be. I put here the Indriya-based treatment, that we have 5 senses and that this is used in healing and the mechanisms. Pichle saal, the Nobel Prize for Medicine went to these 2 people who are working on temperature and touch receptors. And what Agnikarma is showing is the whole science and how it can be applied so easily, and the science will be uncovered by people. This is the complexity of our skin and where the number of neurons that are there. In Maharashtra, there is the procedure of Vidkarma, which is also a very special procedure, and how it gives relief for people based on the Vata theory. So, but how to translate Vata theory and Ama and Agni to this neuroanatomy, we have to consider. And this was, Raviji, this was the reason for my question about research for the future. Asha, the other point I would just like to make here is about interdisciplinary research. There is an opportunity for a lot of interdisciplinary research between the ancient knowledge and the modern knowledge. And I feel this is the research program in Europe here. And they are also looking for new treatments, particularly non-pharmacological interventions. Whether we have some opportunities, we have to consider. And I just want to finish off by sharing with you an event that concluded, that was held on Thursday last week, 12th of May. It was the India-UK Healthcare Conference. And it was held in London at the Royal College of Physicians. The Royal College of Physicians was founded in 1518 by Henry VIII here. And it's the oldest of colleges of learned people here in England. And our High Commissioner was there, Her Excellency Gayatri Sarkumar, High Commissioner of India in the United Kingdom. And the event was opened by Dr. Catherine Edwards, who is the first female registrar for this over 500-year-old establishment here. And Gayatri ji mentioned a very interesting thing. If you look at this in the podium here, is a very interesting structure. Gayatri ji was very quick in connecting this. And this is the coat of arms of the Royal College of Physicians. Or there are 2 points here. This coat of arms was designed in 1546. And it has 2 entities here. On the left-hand side, you see one is the object in the previous slide, which is slightly more presented in detail here, is a pomegranate. And दूसरी चीज यहाँ पे है नाड़ी परीक्षा. So the point here is there may be many opportunities where we can interact between India, especially with therapeutic techniques like what you have, and with large institutions here in the UK. So I invite all who are here with us, who are joining on YouTube or watching on YouTube, to share your thoughts. On one of the floors of the Royal College of Physicians is this collection of medicinal jars. And it's the collection of apothecary jars. And on the right-hand side here, I want to show you this thing, leeches. Leeches were used here for treatment. We still use leeches in India for treatment. And it is very much like in that same space as the Agnikarma thing, in that there is something we still have expertise, which is put in the museum here in the West, here in England. They just have it as a collection now, and a collection of images. So there are areas where we can open dialogue with these people. And shown here, I've highlighted just one. These are all different herbs, pots for individual herbs. I've highlighted one herb here. And this herb is traditionally used to treat inflammatory processes. So there is a knowledge that has become slightly out of fashion here. And it is still in India, it is still being used. We still have that scholarship, we still have expertise, and we need to see how we can connect with these. And shown here is another plant that is used for treatment as an antihelminthic and used for treatments, bladder stone treatment, kidney and bladder stone treatments. So we have some of these things that we can share with people, we can learn. And there are some discussions going on with All India Institute of Medical Science, New Delhi, and other organizations in Austria, in France, much more room for discussions. So I'm grateful for both our speakers today, Ravi ji and Umendra ji, for sharing so much knowledge with us today. Keep in mind that what you are doing in India was also done in other parts of the world. You are still doing it, and we can learn from you. We can make a bridge, we can refine those techniques, we can improve on it. So that is another area where we want Umendra ji, Ravi ji, and everybody here, we should come together to see where we can make future connections. So from all of us who are gathered here today, we were a very large gathering today, very, very large gathering. And we thank both the speakers for enlightening us today. And with those few words, thank everybody who was here. And I return the floor to Pavan ji. Pavan ji, namaskar.
Thank you very much.
And thank you, Seneca, for joining us from Sri Lanka. Please continue to join us. Thank you for your details. I will connect on WhatsApp and we will stay in touch. But we need your guidance, Seneca, from Sri Lanka, because your Sri Lanka tradition is a very old tradition. It dates back to the time of Emperor Ashoka's son and daughter, who came all the way, which was about 500 BC, coming all the way to Sri Lanka to bring all these traditions to Sri Lanka. So we are very, very happy that you are here with us. And please bring your friends and colleagues also to join us in our future events. Thank you, Seneca.
Thank you, sir. Thank you very much.
Pavanji, if Pavanji is not here with us, I'm taking the liberty of passing the floor to Agnikarma ji. Agnikarma ji, pranam ji.
Namaskar, Professor Madan Singh ji.
Namaskar ji, namaskar.
I am trying to manage myself in webinar also along with our program. In my outer room, a lot of discussions and sound is there. So I would like to give comments from here itself. And I was listening, and today I find that the only two persons are of today's webinars a great hero, as they presented their knowledge, especially the whole of the platform enriched with his information. So along with our respect to all the platform dignitaries like Professor Madan Singh sir, Dr. Harish Verma ji, Dr. Jagdishwar Doma ji, Ved Jayesh Thakkar ji, who joined today after a long gap, I think after a tour of his family tour, and Dr. Bharat, Dr. Rakesh Prakash Nigam was also there, Dr. Sunita Pandey, Dr. Preeti Chawla, Dr. Alok Sharma, Dr. Professor Vishnupriya Monti ji, Dr. Samaika ji from Sri Lanka, and good attendance was also today's say event, that it is a 38. It was 38 at the top. So this is what the interest towards the Agnikarma. The moment they found that the Agnikarma is the topic which is to be discussed on today, a number of persons, and of course those who are very much close to our today's speakers, they were also been automatically invited to be there to be benefited for this knowledge. So starting with Dr. Umendra Singh's address, I find that a person who is really skilled, only he has got such a talent and confidence, control over his work, not only his academic work, but also with the help of his dear Piyush Pani. I should say the Piyush Pani word, especially when the Pani works like Piyush, it becomes Piyush Pani. The person becomes the Piyush Pani holder. So he touched the areas where this Agnikarma is to be done. We will be having very good results. Apart from one thing, he in his first sentence itself told that it is giving the better results to allopathy. And it was a question by Dr. Harish Sharma, where do you stand as far as the Agnikarma is concerned? So he started with his very early sentences that it works better to allopathy, and that's why it has got its scope. And of course, it has been always executed by with the hands of the Ayurvedic physicians and Ayurvedic experts. So it really reflects to the importance of Ayurveda as such. He also very much emphasized its use in Dantashul especially. But since that is a very delicate part, so handled with care situation is always needed when a person is handling its application as far as the toothache is concerned. And then two things were there. On one hand, I find that this is to be done as per its indications. At the same time, our learned speakers also made very clear that where it should not be done. That is equally important, indications and contraindications. So when he talked that Twak, Mans, Sira, Charm, Keel, Snayu, Tilkalak, Corn, Keloid, and extra node, these are the areas when it can be performed, the Agnikarma may be performed, and we will be having good results. Along with the areas, just like a question, answer to a question that as far as the cardiac area is concerned, it is contraindicated or he has not got the direct experience. Either Dr. Umendra Singh is concerned or Dr. Ravi Gogia is concerned. The idea is this, that area is the rather precautionary area, one should not involve, and so goes the case with the this tendon, I think, tendon or ligament, sorry. He also talked about that the such areas should not be disturbed with this work. But at the same time, the benefit of it has found it that it is a sort of, as you sir quoted some references, that it is a sort of non-pharmacological intervention. This is one thing very important, that he also, Dr. Ravi also put forward that we are not using any medicine. That's very true. During Agnikarma or after Agnikarma, they may use some sort of a local means antiseptic or just for the sterilization, so that the external areas, body infection may not there. I don't think that it will enter. If it will enter, it will be cauterized with the Agnikarma itself. So it will not exist. But otherwise, for the sake of the medical protocol, it can be observed. We used to prepare the part when we perform any of the even surgery or small incision, so that the protocol that can be observed. So in this way, these both the persons who touch the whole of the area, especially Dr. Ravi Gogia sir also informed that when you perform this thing, it not only gives a good type of thing that as our Abhyang does, so it goes it is also helpful otherwisely on all the Vat Vikaras. Nidra will also be achieved in case of the Anidra cases. Or even more thing, he talked about that we would like to prefer the Agni Shalaka of individual one metallic instead of having the Panch Dhatu, so that we don't know in the preparation of Panch Dhatu which are the Dhatus were used. So it is also a very specified thing, but exclusively copper, I think it may not be, because of it gets a heat very early. So it's a good conductor of heat. So I don't think that copper Shalaka is of no use in that way. So overall, what I feel that they made us with a great knowledge that Agnikarma is not a common karma that everybody is doing, just like Dant Dhavan or Anjan or Gandush Dharan. It's a very specific work. Only the skilled persons with their top class knowledge and very clear in his mind can develop the confidence, and that confidence makes him capable to perform such type of Agnikarma. And when they do it, not only the patient is benefited, the whole of the theme or the our Ayurveda itself is getting benefited, and he is receiving the yash, a name and fame as a return of this work. So I appreciate both of the today's speakers, distinguished speakers, and we greet from our side that they made our today's webinar's topic very, very, very informative, and I think it will give a sort of stimulation to all the newcomers like BMS and MD scholars, that they may come, and a day may come that out of the surgery, it may become a branch just like Sanghaharan, another thing, or in the case of Panchkarma or Jaloka, Agnikarma will exclusively be getting that much of information importance that tomorrow an exclusive thesis may come if the patients voluntarily having coming for this work with at least with a module or group of 20-25 patients or so. This may be another thirst area for the Agnikarma if our good centers like Jamnagar, Jaipur and BHU, if they come with this Agnikarma, though the work might have gone to some extent, but exclusively if any MD scholar takes some benefit of it out of any of the indication which is important or occurring again like say anorectal problems or other problems where it can be done. So I think the importance of Agnikarma will be much more utilized. So with these words, I would like to again thank all our great speakers along with our great dignitaries of today's webinar's platform. Thank you so much. Over to Dr. Professor Madan Sharma ji, Madan Thangvelu ji and Pawan Sharma ji. Thank you.
अग्निहोत्री जी, thank you so much. हमारी तरफ से एक सवाल है जी. If we want to get MD/MS thesis Agnikarma के ऊपर,
right?
And if you are an examiner or a guide, कितनी एक patients चाहिए जी? MD या MD thesis में 50, 25, 30?
Sir, सुनिए, 50 is not possible. 50 तो नहीं हो पाएगा, because the person himself who will like to perform this work will be the beginner. So for that, in first year it is a common year. Second year they keep on having the clinical work, and along with the thesis topics related reference collection, literary review, allopathic, Ayurvedic, and rushing to laboratory, to hospital, to library. So the importance is this: if they have got a mixture of 10 to 15 patients, male and female, then again they will be having some better area, male and female both. So 15 to 20 patients they can start with. 4 to 5 may drop during the course. Usually it happens. It may be favorable to them or may not be. So if we can take granted that 10 to 15% cases may lead a full voluminous work with all the inferences and database calculation with t-value and p-value. So I think in that way we would be in position to assess as a starting say one thing, and the work has already done. So literary review will be a supportive to that that is research scholar. So I think, but these person, Dr. Ravi and Dr. Umendra may better inform. As a teacher, I can say that 15 to 20 is starting review. I would also like to seek the information from these two guys, if you can, please.
Thank you, Agnihoत्री ji, for elaborating. 15 to 20 is a good number. Ravi ji, अगर आपके पास आपके साथ एक MD/MS thesis की थोड़ा co-supervision करना हो, BHU वाले या कहीं और, शायद दिल्ली यूनिवर्सिटी का या राजस्थान की, आपके पास कितने टाइम में आएगा जी? 50, 30, 20 पेशेंट, वो MD क्वालिटी की तरफ. एक और जी, कोलैबोरेशन, अगर इसके अंदर थोड़ा ऑल इंडिया इंस्टीट्यूट दिल्ली वाले उनको भी ले आए थोड़ा ऑब्जेक्टिव मेजरमेंट्स के लिए, so the student can also learn that aspect. Will you be happy to discuss this possibility or guide some students Is it possible to get at least 20 patients for 1 or 2 conditions in 1 year?
Sir, we can have students of 20 in number, but we should have a analytic study. We should have patients treated through Agnikarma. We should treat 20 patients through Agnikarma and 20 patients treated through allopathic medicine or any other parameter. We can treat it. We should have an analytic study between 2 of them. We can give better result in 20 patients also, because 50% we can have a best idea. But in case of PhD, the total number of patients which we are having in research module, that should be more than 100 or equivalent to 100. But at the stage of MD, 40 to 50 patients are enough. But we should have an analytic study between 2 of them. We should have if we have a comparison between them, we will have a great idea which one is better. And 20 patients from same disease, because you have to convince the patient that Agnikarma is having hot chalaka, you have to apply over that. That is very difficult to convince them. Even then 20-20 means equal ratio of the patient, that is more than sufficient. Minimum 20 patients is required.
Thank you. Thank you, Raviji. Thank you. I'm happy that we have got this discussion. Agnikarma ji has pointed as an important outcome of today's webinar. I think this is a very, very important outcome, that we must start to put some benchmark. Shayad MD thesis say we can start something that will be very exciting in this space. Agnikarma ji, I don't know if you are agreeing with this, but thank you for pointing to this academic.
I think Dr. Ravi really caught my point, and I am really seconding him. At MD level, 2020 formula, and as I told that these 2 guys are our today's openers, like Sehwag and Sachin. So he is also talking about 2020. So that 2020 is a mark of MD level, and then of course for PhD it is 80 to 100 to karna hi padega, because we have got a bigger time period, like 5 years, 3 years, 4 years, and as far as the MD is concerned, it is 36 months total. So for that selective period is there only 18 months. So this is a concession for the MD scholar, and for PhD we will be having a bigger volume. Thank you.
Agnikarma ji, हमारी तरफ से एक सवाल और जी, इसमें अगर will you accept थोड़ा सा integrative medicine इसके ऊपर, थोड़ा हमारी modern neurology, neurophysiology वगैरह इसके अंदर थोड़ा सा PhD level पे अगर ले आए, थोड़ा सा आप लोग BHU वाले क्या कहेंगे इसके ऊपर, या CCRS वाले क्या कहेंगे जी इसके बारे में?
Actually सर होता क्या है कि इसका भी एक प्रोटोकॉल होता है. PhD में अगर हम बहुत कुछ एक्शन ले लेंगे तो फिर वो एक खिचड़ी टाइप का घपला हो जाएगा. We may not reach to any concrete decision. As far as the MD level is concerned, it's well analytical or comparative can be done, and we can have one other point like say control or placebo. There are so many varieties and sub varieties to proceed further. And at MD level, otherwise, apart from the clinical departments, there is always understanding that the student is supposed to understand the attitude and the methodology of research. He is not responsible, or he is not said to be compelled to come with some positive means a result. Result maybe may not be, but as far as the PhD work is concerned, we are supposed to carry on that research work or that clinical work, that therapeutic work, that pharmacological work, or that say toxicity assessment work, where we should reach some decision and be in position to make a decision that this works or this not works. It contains 80% toxins or not contains. So at that PhD level, it is a decisive work. It gives some decision. So that is the thing. I think doctors are of the same opinion that PhD work is also having a certain protocol. How many categories, how many subdivisions we can keep. As far as the integration is concerned, I don't think that integrated use, we will in position to say something that whether Ayurveda did this work, Agnikarma did this work, or the medicine did this work, or the allopathic medicine did this work. So there will be a dilemma to take a decision. This is my opinion. I think.
I think the point is very important. Maybe some aspect of research design, maybe thoda. The reason why I'm asking, sir, is कि chronic pain के ऊपर, low back pain के ऊपर, हमारी दिल्ली में All India Institute में there is some good PhD thesis coming out on objective measurement of pain और पूरा neural pathway map करके. तो कुछ चल रहा है वहाँ काम, योग लगा के, उसमें 20-25 आसन है उनमें, and they are doing some very effective work to compare yogasan for lower back pain, and उसका पूरा neurology भी mapping हो रही है. तो मेरे मन में आया कि शायद we can take it also into that Ayurveda space थोड़ा, क्योंकि but we have to discuss this. But I'm grateful that we have touched that point today कि आज थोड़ा सा उस तरफ भी सोच, we have come to that point. We wanted to get, Ravi ji, we wanted to get distill thoda outcome इससे कि क्या है, शायद this is a very good outcome today for our meeting. शायद हमारे साथ है निगम साहब, राकेश निगम जी, अगर निगम साहब से तरफ से कुछ अगर हो, please, the floor is yours, निगम जी.
Sir, I would like to say something.
Please, Ravi ji, please, the floor is yours.
Next time, whenever I will present my Agnikarma webinar or seminar or whatever it is, I will try to present this webinar through digital objective parameter by measuring all parameters, because this will give a right information to our newcomers, and this will convince other people belonging to research methodology. So this gives a impactful mark to other people who are not concerned, who are not willing to accept this Agnikarma or Ayurveda. If you are convincing them through their own language, scientific language, through digital parameter, objective parameter, this will be more impactful. I will try to do through digital parameter. I will try to adopt all types of digital parameter, how to combat this pain. That means whenever we are measuring pain, we have some sort of range of motion of joint that can be measured through goniometer. After the Agnikarma, what were the range of motion before treatment and after treatment, we can measure it, and few other parameters that will give an impactful mark towards our scientific society. Thank you.
Thank you, Ravi. But are you saying you already have a device for doing objective measurement? आपके पास है कुछ?
Yeah, I have one goniometer also. Because it is an instrument by which we can range of motion of any joint can be measured before treatment or after treatment. So this gives me a great idea, great happiness that range of motion before treatment, and there is gap between range of motion before treatment, after treatment. Marvelous efficacy between them. So this is the best way by which we can convince scientific forum.
Raviji, last question before we draw this event, or before Pavanji, we give the floor back to Pavanji. Last question: how much interaction do you have with the Ayurveda academic institutions in Delhi and around Delhi? Shayad Haryana ke taraf ya Najafgarh, Delhi mein. Do you have any interaction with CB-PACs or with Sarita Vihar or with Haryana, with Rohtak? Kuch hai?
Sir, I am not expert. I am in learning field. Okay. Expert people in Agnikarma, they are all present in CBAC or All India Institute of Ayurveda, Sarita Vihar. I am just a single new bird of sapling. I am not the expert. I am learning field. I have interacted with people also, but I have not invited to give a lecture because they know each and everything about it. So, but I have been invited to give lecture on Agnikarma on to this non-medical person also. They have invited me, but institute level, they have their own best experts. I'm not expert. I'm in learning phase, little bit, doctor.
Raviji, the reason why I'm asking this question is you are also getting patients.
Yeah.
So that is the most important thing. If you are getting 50 patients or 100 patients a year, then that is a big patient number, which is in addition to what is going to Sarita Vihar or addition to what is going to CB-PACs, number one. Number two, objective assessment. If you have something better for objective assessment to pain and motion, better than Sarita Vihar or CB PACS or other colleges, then why not? Then
Okay,
you
I will
should
try
become.
I will try to acquire
Madan
all.
sir, Madan sir, I think that this is Dr. Ravi's modesty.
Modesty, Hanji.
Definitely, he is not accepting what he is doing,
Yeah,
and the
I know.
fact is that he has done that much. That whatever
Already.
Sarita Vihar persons and Chaudhary Brahmaprakash persons are, he is saying that they are expert, but his expertness is now exposed. So
Yes,
this
exactly.
is your modesty. Please don't underestimate yourself. It may be another thing that you are posted in an academic institute or not, but your working is being held by
Exactly.
us. So you cannot escape in this way.
Exactly. Very well said, Agnihotriji, because you are also handling patients, they are also handling patients. Or aapke paas, you are also getting good results. So that is the baseline. Yeah.
I will try to make a option to get digitalized
Very good.
results by measuring through objective parameter that will give a remarkable mark towards society. I will try to gather all other parameters also. So
Thank
that
you.
will the best solution, but best advice I have taken from you. I will search new parameters, which
Thank
I
you.
know that is enough, not so enough. We have to learn new other parameter also.
Absolutely. Raviji, if you would be kind enough, you have shared in your slides your contact details. If you could put it on the chat box again, then everybody here will be, whichever is the best number. I think the point here, I just want to echo, Raviji, I just want to echo Agnihotriji's comment here, that we want more young students to come into these areas, you know. Achaji, thank you so much. Thank you. So, Ravi, the point here is we want more young people to see the benefits, you know, see this, what is available in Ayurveda, and we want more of them to get excited about this area, you see, because only then can we pick up momentum for future work. So that is, it doesn't matter where that momentum comes from. If it comes from the field, if it comes from clinics like yourselves, then that is also welcome. Because at this point, we just want young students to say, oh my God, there is this wonderful procedure here, and I also want to specialize in this. Harish ji, floor is.
जी सर नमस्कार डॉक्टर रवि जी मैं भी एक आपको आइडिया देना चाहता हूँ आई एम मोर इन कॉमर्स हम लोग अपना बिजनेस करते हैं यहाँ तो इफ यू कैन डू सम स्टडी comparing Agnikarma with epidural injection in lower backache, you can reach to anywhere in the world.
Okay.
Epidural.
I can think about it, and this is the best measure of your thought process, which you have incorporated in your mind. This can be done because we'll have to just measure the efficacy through Agnikarma or any epidural injection. Which one is better? If he is giving you a response, if he is giving you an analgesic property by giving Agnikarma for few hours, that is all helpful also. So why there is incorporating this epidural injection of any steroid, that will create some sort of trouble in future also. So better is if it is a comparative study is there. So I would like to do it. I have not got any chance, but I have kept in mind whenever any scope will come to me, I will try to incorporate in my thought process and practical life also.
As you said, you have infrastructure, you have the patients, you have the technology. So it is good for you. If you have a comparative study, then you can reach anywhere in the world. Because if you can provide similar relief or the better relief than epidural injection for pain relief, because all the epidural injection just provide pain relief to the patients. Rather, it causes more degeneration after epidural injection. The cartilage is more damaged. If you can have comparative study, then you will have a great honor in the world. Thank you.
Good.
Thank you, Harish ji. And Harish ji, thank you so much. I think, Pavan ji, if there are no more comments from the floor, then I take the liberty of giving the floor back to Pavan ji. Pavan ji, thank you so much for bringing such two wonderful speakers to the platform today. We have learned it was, I must say that the total audience today was the largest, I feel. Agnihotriji, I think it is the largest we have had till now. And somehow there is a big interest there. There are a lot of people wanting to learn how to do therapy for pain. Acute management is very exciting for them, you know. And you have excited many people. There are still many people here with us today. And there is an opportunity to come back again. I hope Pavanji will bring us back together again. So
tomorrow is hypertension day, sir.
Hypertension day, dekho.
And most of the public is affected by hypertension.
Absolutely.
And so hypertension care and cure by Dr. Brijesh Mishra, Vice Principal, Nagpur College, Dr. Swagat, Professor Agra, Dr. Ajay Kumar Pandey, Associate Professor, BHU, will guide us on hypertension care and cure. And day after tomorrow, metrology day is there. So we have related that metrology day with Pramana. So right dose for holistic health. So that is our topic. Please join us moreover every day. Thank you. Thank you very much. Good night to all. Good night.
Shubhratri. Thank you, Ravi ji. Agnihotriji, pranam ji. Namaskar.
Thank you, sir. Thank you.
Namaskar. Namaskar.
Doma ji, namaskar. Good night.